Hello NCLEX aspirants! Welcome to our NCLEX practice test series. This video contains a full-length practice test. We always take feedback from our students who pass the exam to understand which questions were asked. After gathering feedback from 5,000 students who passed the NCLEX exam in the last 5 years, we've compiled these 4,500 frequently asked questions. These are the board's favorite picks. Are you ready to ace the NCLEX on your first try? Use our 30-33 strategy. In 30 days, watch 30 practice test videos. Watch each video 3 times. By following this method, you'll master 4,500 NCLEX practice questions and boost your chances of passing NCLEX on your first attempt. Stick to the 30-33 rule and achieve your NCLEX success. You can also enroll in our online course to pass NCLEX with confidence. We are offering a 70% discount for this month only, and seats are extremely limited. Don't miss out on this incredible opportunity to secure your success before prices rise. The link is given in the description box. And don't forget to hit that subscribe button. And we've got 30 more amazing practice test videos coming your way. All right, let's dive in and start the video.
Question number 1. A nurse is preparing to administer a sedative before a client undergoes surgery. What action should the nurse take first? A. Confirm the presence of an IV access line. B. Measure the client's vital signs. C. Verify the completion of the preoperative checklist. And D. Ensure that the surgical consent form has been signed. The correct answer here, it is letter D. So, before administering a sedative, the nurse must verify that the client has signed the surgical consent form, because we know that sedatives can depress the central nervous system. It can impair cognitive functions such as reasoning, memory, and also decision making. And so if the client has not provided informed consent prior to sedation, their ability to comprehend information and make an autonomous decision may be compromised. And so legally and ethically, informed consent must be obtained while the client is fully alert and mentally competent. Now, why is letter A incorrect? Well, we know that IV access is essential for administering medications, including sedatives, but it is not the first priority in this case, because establishing the IV access does not impact the client's ability to provide informed consent, which must be ensured before proceeding with sedation. B is also incorrect. We know that assessing vital sign is a very important aspect. However, it does not take priority over verifying informed consent, which is a legal and ethical requirement before administering sedatives. The same thing with letter C, another incorrect option. The pre-op checklist includes multiple tasks. It could include verifying allergies, confirming NPO status, and ensuring all necessary documentation is completed. While this is important, ensuring that informed consent has been obtained is the most critical step before sedation, because failure to do so can result in legal and ethical consequences. Now, in order for you to appropriately select the answer here, you have to identify the key concepts in the question stem. And the phrase "before a client undergoes surgery" indicates that the action must be done before the surgical procedure begins. And the mention of sedative suggests a central nervous system altering medication that can impair cognition and decision making. And another strategy for you to do is to recognize the hierarchy of pre-op priorities. So again, informed consent is a legal and ethical requirement that must be addressed before any sedating medication. Now, the tasks like IV placement, vital signs, checklist verifications are important, but do not override the need for informed consent. Okay, so another strategy for you to use here is to use the elimination process. We know that A and B are focusing on physical preparation, but do not address the legal requirement of informed consent. C is broader. It includes multiple tasks, whereas D is the specific essential step that must be completed before sedation. Let's proceed to question number 2. A client diagnosed with endometriosis expresses concern about experiencing hot flashes from her medication. She shares that her mother found this symptom bothersome during menopause. Which medication is most likely responsible for causing hot flashes? A. Diclofenac. B. Ergonovane. C. Estrogen. D. Leuprolide. The answer is letter D. That's Leuprolide or Lupron. So the case again mentioned about a patient that has endometriosis who is worried about hot flashes from her medication. So in this case, she even mentions that her mom struggled with them during menopause. So she already has an idea that this symptom is related to hormonal changes. Now, the question is asking which medication is most likely causing these hot flashes. Well, why is Lupron the correct answer? Well, this is a drug that is a gonadotropin releasing hormone agonist. It means that it shuts down estrogen production by inhibiting the luteinizing hormone and the follicle stimulating hormone. And since estrogen plays a big role in regulating body temperature, reducing it can lead to hot flashes, similar to what happens in menopause. And this is why our client is making that connection to her mom's experience. And just to give you a quick review here about Lupron, it is something that is commonly used for endometriosis treatment because, again, it suppresses estrogen, which helps shrink the misplaced endometrial tissue. But as a trade-off, it can bring menopause-like side effects, including hot flashes, vaginal dryness, and even bone density loss. Now, what about the other options? Like letter A, this is incorrect. Why? It is a non-steroidal anti-inflammatory drug used for pain relief, including menstrual cramps, but it does nothing to hormone levels. It wouldn't cause hot flashes. Letter B is incorrect as well. It's used to help contract in the contraction of the uterus, and mostly to control postpartum bleeding, but it's not related to estrogen suppression, so it won't trigger hot flashes. Letter C is another incorrect option here. Estrogen, Premarin, actually does the opposite because estrogen relieves hot flashes rather than causing them. And so giving estrogen would counteract the effects of Lupron, which is why it's not typically used to treat endometriosis, since we're trying to suppress estrogen, not increase it. Now, your strategies in answering this question would include spotting the key symptom, and that's the hot flashes. So we need a drug that affects estrogen levels. And also think about menopause. Hot flashes in menopause happen due to low estrogen. So any medication that reduces estrogen, like Lupron, will likely cause the same symptom. Now, you need to eliminate unrelated drugs such as the NSAIDs and the ergonovane. These don't mess with estrogen, so they're taken out. And you need to really follow this approach because, again, Lupron is like a clear answer. It mimics menopause by lowering estrogen, leading to hot flashes. Let's get into item number 3. A nurse is caring for a client receiving 40% oxygen via Venturi mask. What actions are appropriate? Select all that apply. A. Prevent the blanket from covering the mask's orifices. B. Make sure the mask bag doesn't deflate completely. C. Verify the correct adapter is attached to deliver the prescribed oxygen concentration. D. Keep the oxygen source higher than the client's airway. And E. Adjust the flow rate based on oxygen saturation. This is a select all that apply type of question. There are 2 answers, and those are letters A and C. Again, let's go back into the Question. So you are caring for a client receiving 40% oxygen via Venturi mask, and what you should do. Now, letter A, let's look into this one. The step here basically will prevent this from covering the mask orifices. So the Venturi mask has small holes on the adapter that will allow room air to mix with oxygen, so it can help regulate the precise concentration delivered. And so if these holes get blocked, let's say by a blanket or a pillow or even the patient's hand, the oxygen concentration can change, which defeats the purpose of using this mask. Letter C is also one of the correct answers here, because Venturi masks come with the color-coded adapters, each designed to deliver a specific oxygen percentage, maybe 24%, 28, or 40%. So the nurse needs to double check that the right adapter is in place so the client receives the prescribed oxygen level. Now, the other options, options B, D, E, are all incorrect. B, specifically, the Venturi mask does not have a reservoir bag. So this is a feature of a non-rebreather mask, which delivers to higher concentrations of oxygen. And since Venturi masks work differently, worrying about a non-existent bag doesn't really apply. Another here is letter D, another incorrect option. Unlike gravity-dependent oxygen delivery methods like a humidified tray collar, a Venturi masks deliver oxygen at a set flow rate, so meaning the position of the oxygen source doesn't really matter. E, another incorrect option, is incorrect. A Venturi mask delivers a fixed fractionated oxygen. So it means that the oxygen flow is preset based on the adapter being used. So you don't adjust the flow rate based on the patient's oxygen saturation, but instead the FiO2 setting should be changed if the oxygenation needs to be adjusted. Now, how are you going to approach this type of question? Well, you got to first understand how a Venturi mask works. So it's all about delivering a precise oxygen concentration with controlled room air mixing, and also eliminate choices that don't apply. So if an option mentions a reservoir bag, adjusting based on oxygen saturation or oxygen source positioning, those are red flags because they don't match how Venturi masks function. Now, you also need to look for the details about ensuring accuracy. So options related to the adapter and preventing obstruction should catch your attention, so as these can directly affect how the mask delivers oxygen. Let's have number 4. After undergoing abdominal surgery, a client suddenly complains of numbness in the right leg and unusual numbness in the toes. What is the nurse's initial action? A, elevate the legs and encourage increased fluid intake. B, advise the client to remain in bed and contact the healthcare provider. C, massage the client's legs to promote circulation and cover with a blanket. D, warn the client about the risks of prolonged bed rest and suggest moving around. All right, so what is going on in this question? Well, you have a client that just had an abdominal surgery and suddenly complains about numbness in the right leg and toes. That's a red flag. Something could be affecting their circulation or maybe nerve function. And so what should you do first? So the correct answer here is letter B. Why is this the best choice? Well, when there is going to be sudden numbness in a limb, it could signal a serious issue. Maybe a deep vein thrombosis, could be nerve damage or impaired circulation. Well, what is the priority here? You got to keep the client still and notify the provider immediately to prevent any complications from worsening. Well, The movement could be dangerous. So if there's a blood clot, as it might dislodge, it probably can lead to a pulmonary embolism, which is another life-threatening emergency. Now, why not letter A? Elevating the legs and encourage increased fluid intake. Well, we know that fluids can help prevent clot formation, but this is not the priority once the symptoms have already developed. Letter C is another incorrect option here. You never massage a limb with a potential circulatory issue. So if a clot is present, massaging could break it and it could possibly make it go into the upper circulation, can lead to pulmonary embolism. We know that keeping the client warm is fine, but circulation problems require medical intervention, not massage. Letter D is also a bad option this time. Normally, ambulation is going to be encouraged after surgery to prevent blood clots, but if a clot is suspected, movement is dangerous. The client should not be encouraged to move until a healthcare provider evaluates them. Now, your strategy in answering this question is to recognize the red flag symptoms. The numbness, that's a big one right there. Especially that they're talking about numbness in the toes. So you have to think about the circulation issue, nerve issues, possibly a DVT or nerve compression. Now, you also need to look for the answers that prioritize safety. So in this case, keeping the client still and alerting the provider is the safest approach. And another thing that you can do here is to eliminate those unsafe actions. Anything that encourages movement, massage, or unnecessary intervention should be ruled out. Now, my last thought about this type of question. So when you're going to take care of a post-op client and they suddenly develop numbness in a limb, you need to think really fast. Is it a nerve issue? Is it a circulation problem? Is it a blood clot? The safest move is to keep them still and get medical help ASAP. Let's have number 5. A client recently diagnosed with metastatic lung cancer experiences severe coughing and breathlessness after their provider discusses their condition. The client states, "It's just a cold. I'll recover soon." How should the nurse respond? A. Can you share more about what you understand about your condition? B. What do you recall about the diagnosis given by your provider? C. Didn't you just receive distressing news today? D. You don't have a cold, you have a lung cancer. The answer here is letter A. Well, what is really going on in this scenario? Well, the client has just been diagnosed with metastatic lung cancer, which is a life-threatening, life-altering, and distressing diagnosis. So immediately after discussing their condition with their provider, they start experiencing severe coughing and breathlessness, but dismiss their diagnosis saying, "It's just a cold, I'll recover soon." So this kind of a reaction suggests denial, which is a common coping mechanism when someone receives overwhelming and distressing news. So how are you going to respond in a way that encourages therapeutic communication in this case? Well, I've said already that's letter A, right? Letter A, it can gently encourage the client to express their thoughts without directly challenging their belief. It will also respect their coping mechanism while also creating space for discussion about their diagnosis. And the response here can also help the nurse assess the client's level of understanding and also emotional state without forcing reality on them too soon. Now, what about letter B, which is an incorrect option? We know that it seems like it's an open-ended question. It feels more like a test than a supportive conversation. So if the client is in denial, they might feel pressured or defensive, making it harder for them to open up. And so instead of forcing them to prove they heard the diagnosis, it's better to let them share their feelings freely. Letter C is another incorrect option here. Labeling the news as distressing may actually amplify the client's anxiety, and it will push them further into denial. And the response here also can focus on the emotion, which is the distress, rather than helping the patient process their thoughts. And a better way of approaching this case is to let the patient define their emotions instead of imposing a label on their experience. Now, letter D, another incorrect option. It's kind of blunt. It's too harsh, too soon. We know that's actually factual, but this response directly contradicts the client's belief, which can cause them to shut down emotionally. And so instead of helping, this statement may push the client deeper into denial and can damage trust in the nurse-client relationship. So when you're going to approach this kind of test question, you need to recognize denial as a coping mechanism, because this client just got devastating news. It's normal for people to reject reality at first because the truth is overwhelming. And you need to choose the response that encourages therapeutic communication. And the goal is to keep the conversation open, not shut it down. Another approach here is to eliminate responses that challenge or dismiss the client's feelings. So anything that forces reality too aggressively, like the option D, or putting the client on the spot, like in option B, should be ruled out. So let's move on to item number 6. A pregnant woman in a restaurant experiences a complete airway obstruction due to a food bolus. How should the nurse modify the abdominal thrust maneuver for this individual? A. Position the fist with the pinky side against the body instead of the thumb side. B. Apply forceful compressions to the middle of the sternum instead of the upper abdomen. C. Wait until the woman loses consciousness before beginning thrusts and stop if unsuccessful after 6 attempts. D. Perform the maneuver while the woman is lying down instead of standing. So, what's the safest and most effective way to help this client? Well, the correct answer here is letter B. Well, why? Because in pregnant individuals, performing abdominal thrust below the diaphragm could put dangerous pressure onto the uterus. It can potentially harm both the mother and fetus. What you got to do instead is to perform the chest thrusts. You're going to apply at the middle of the sternum, and this is the recommended technique because they can still generate enough force to expel the obstruction while protecting the pregnancy. So you have to keep in mind that the chest thrust replaces abdominal thrust in pregnant individuals in this case. It is the safest way to relieve an airway obstruction without putting the fetus at risk. Now, why is letter A incorrect? Well, this is not a recognized modification for the Heimlich maneuver. The thumb side of the fist should always be against the person's body, regardless of whether you're doing abdominal or chest thrusts. And so changing the fist positioning does not address the main issue, which is avoiding abdominal pressure during pregnancy. Letter C is another incorrect option here. Absolutely not. You're not going to do this kind of maneuver. Waiting for the person to lose consciousness can delay life-saving intervention, and it will increase the risk of death from asphyxiation. So the goal here is to act immediately, not to wait for the situation to get worse. And in addition to that, there's no rule about stopping after 6 attempts. You're going to continue until the obstruction is cleared or the person becomes unconscious, at which point you begin CPR. Letter D is incorrect. Unless the person is already unconscious. We know that the Heimlich maneuver is performed while the person is upright because the gravity helps in dislodging the object. And so if the person becomes unresponsive, then you lower them to the floor and you start CPR. But if they are still conscious, they should remain standing while receiving the chest thrusts. Let's move on to the next question, number 7. A construction worker arrives at the emergency department with a wound on the right calf that has been open and draining for 3 days. The healthcare provider orders IV antibiotics and contact precautions. What action should the nurse take before transporting the client to a room? A. Administer the prescribed antibiotic. B. Wear a gown, gloves, and protective eyewear. C. Arrange for an airborne isolation room. And D. Apply sterile dressing over the wound. The answer here is letter D. Why letter D? Well, the key here is infection control. The client has an open wound that has been draining pus for several days, indicating a bacterial infection. So contact precautions are meant to prevent the spread of infection, which can happen through direct contact with a wound or contaminated surfaces. So when you're covering the wound with a sterile dressing, you're going to reduce the risk of contaminating the environment or exposing others to the infection during the transport. So you have to contain the infection and prevent the spread. Now, why is letter A incorrect? We know that antibiotics are important to treat the infection, but they don't need to be administered immediately before the transport. The priority right now is infection control. You can administer the antibiotics once the client is in the appropriate room and they're settled. Now, letter B is incorrect in this case. We know that personal protective equipment is required when handling an infected client, but this answer misses the point of infection control before transport. That is the key here. Again, the personal protective equipment is required when you're handling an infected client, but this option alone misses the point of infection control before transport. So the nurse should indeed wear the PPE when interacting directly with the client, but it's not the first action before transporting them. So you have to make sure that the wound is covered. And of course, the PPE should have already been worn prior to the transport. Okay. Letter C, arrange for an airborne isolation room. This is an option that's actually misunderstanding of the precaution. We know that airborne precaution is used for patients that may have infections that spread through airborne particles such as TB or chickenpox. And so the wound the client has is actually infected possibly by a bacteria that spreads through direct contact with the infected area, not through the air. So therefore, contact precautions are what's needed, not airborne isolation. So your approach in answering this question is to first identify the infection type and transmission. Again, this is a contact-based infection, not airborne or droplet. So you have to focus on what you can do to prevent the spread of infection via direct contact, and also to think about infection control. So you have to think about what action will contain the infection before the transport. And so a sterile dressing over the wound will help prevent contamination. And another strategy here is to eliminate those other options that are less urgent, such as administering antibiotics or PPE for the nurse or arranging the wrong type of isolation. Don't necessarily address the immediate concern of infection spread during transport. Let's have number 8. A nurse is measuring a client's blood pressure. Which actions ensure an accurate reading? Select all that apply. A. Inflate the cuff approximately 30 mmHg above the point where the brachial pulse disappears. B. Release the valve gradually to allow pressure to decrease by 2 to 3 mmHg per second. C. Completely deflate the cuff and wait 2 minutes before retaking a measurement. D. Position the arm at heart level. And we have letter E, place the lower edge of the cuff directly over the antecubital space. This is a select all that apply question. And so there are multiple answers. We have letters A, B, C, and D. Why letter A? Well, this step is crucial to ensure accurate measurement of the systolic blood pressure. And so by inflating the cuff at least 20 to 30 mmHg above the point where the brachial pulse disappears, which is actually what we do as a palpatory systolic pressure, you're going to ensure that you have surpassed the actual systolic pressure. And so this is going to prevent you from getting an accurate or lower reading due to a cuff that is not inflated high enough. And so this is a safe range to guarantee that cuff is inflated to the right point. B is also correct. The key here is the rate of deflation. And so when you're gradually releasing the valve, it will allow for a much precise measurement of the carotid cuff sounds, which are the sounds that you're listening during the process. And so if you let the cuff deflate too quickly, you might miss important details and get an inaccurate reading, especially for the diastolic pressure. Letter C is another correct option here. So after you measure, you must completely deflate the cuff and wait for at least 2 minutes before retaking the measurement. And so if you don't wait, the venous congestion can cause a false high reading when you retake the measurement. And so you have to make sure that you have to observe the waiting period to ensure that the blood flow returns to normal, giving you a more accurate subsequent reading. Now, letter D, another correct option. You need to make sure that you are positioning the arm at the heart level, which is the most essential part of getting a most accurate blood pressure. Because if the arm is too high, it can cause a falsely low reading. And if it's too low, or the position of the arm is too low, it can also cause a falsely high reading. And so the heart level is the correct reference point to ensure the most accurate measurement. Now, why letter E is incorrect? Placing the lower edge of the cuff directly over the antecubital space. This is the key mistake in this question. We know that the antecubital space is where the brachial artery is located. And so if you're going to place the cuff too low, it will obstruct the artery. It can lead to an inaccurate reading. And you have to recall that the proper placement of the cuff should be about 1 inch above the antecubital space to ensure proper blood flow and accurate measurement. So don't forget to recall the proper techniques in measuring the blood pressure. Let's have number 9. A nurse is assessing a client scheduled for surgery to repair a recticule. What symptoms would the nurse expect the client to mention? Select all that apply. A, feeling a sensation of pressure or the need to push down. B, experiencing urinary leakage under stress. C, frequent urinary tract infections. D, pain during intercourse. And E, abdominal cramps. So the question here is actually wanting you to identify the symptoms that are most commonly associated with this condition, a recticule. The answers here are letters A and D. And why letter A? Well, a recticule can occur when the rectum protrudes into the vaginal wall, and this can cause an increased pressure in the rectum. It can lead to a sensation of bearing down or the urge to push. And so the client will likely experience this as a feeling of pressure in the vaginal or the pelvic area. And this is a classic symptom of recticules. Letter D is another correct option here, because when the rectum pushes against the posterior vaginal wall, it can cause discomfort during intercourse. And this is a common issue for individuals with the same condition. And the pressure from the recticule can make vaginal penetration so painful, leading to dyspareunia, which is the painful intercourse, which is a common symptom. Now, why is letter B incorrect? Well, letter B is this option is incorrect because this symptom is more commonly associated with a cystocele, not a rectocele. And I want you to recall that a cystocele occurs when the bladder drops into the vaginal space. It can lead to urinary stress incontinence when they're sneezing or coughing or exerting pressure. And this is not a typical symptom of a rectocele, which involves the rectum and does not directly affect urinary function. Letter C, another incorrect option, is going to be discarded because urinary tract infections are more often linked to cystoceles, where the bladder is displaced and can affect urinary flow. So in contrast, rectoceles primarily affect the rectum, and we know that they can lead to some vaginal discomfort. They do not typically cause recurrent UTIs. Letter E, another incorrect option here. The abdominal cramps are more associated with gastrointestinal issues or other conditions involving the intestines, not rectoceles. Just to recall that a rectocele can cause pelvic pressure, abdominal cramps, but are not a characteristic symptom of this condition. All right, so when you're going to approach this type of question, you need to understand the anatomy and the symptoms. Again, rectoceles involve the rectum protruding into the vaginal wall. It can lead to symptoms like pressure, painful intercourse, while the cystocele involves the bladder and lead to urinary issues. Let's have number 10. While recovering from abdominal surgery, a client develops thrombophlebitis. What signs should the nurse expect to observe during assessment? Select all that apply. A, warmth in the lower leg. B, cough pain. C, intermittent claudication. And D, redness at the site. E, swelling with pitting in the lower leg. And F, bruising near the ankle. So you're going to recognize the signs that would be indicative of the thrombophlebitis. So what would be the answer here, or answers rather? These are your letters A, B, and D. Why A? Because thrombophlebitis can cause the inflammation of the vein. It can lead to an increase in the blood flow to the affected area. And that increased circulation can result into localized warmth, which is a classic sign of condition. And so if you feel warmth in the lower leg, it's likely due to this inflammation. Now, letter B, which is calf pain, this can happen because the vein is inflamed, often accompanied by the swelling. And the inflammation can cause this discomfort, especially when the pressure is applied to the area. And the pain here might be more observable in the calf area where the clot is. So the symptom is expected in thrombophlebitis. Another is letter D, redness at the site. It's because of the inflammatory response. And so when the vein becomes inflamed, the blood vessels dilate to allow more blood flow, which results in the skin over the area turning red, and this is another classic sign of thrombophlebitis. Now, why letter C is incorrect? Intermittent claudication. We know that this is the type of pain that is felt in the legs when a patient with peripheral arterial disease starts walking. And this is something that can happen because of the poor circulation to the legs, especially during a physical activity. So this is not a symptom of thrombophlebitis, which involves venous inflammation. Okay, so it doesn't really apply here. Another option here, letter E, is also incorrect. We know that swelling can occur with thrombophlebitis, but the pitting in the lower leg, which means indentation, can remain after you're going to press or palpate the skin. It's actually more common in heart failure or possibly kidney disease, but not thrombophlebitis. And so I want you to recall that in thrombophlebitis, the type of swelling tends to be more localized, non-pitting, and so the pitting edema is not characteristic. So eliminate this one. Another is letter F, bruising near the ankle, because bruising typically occurs when there's bleeding beneath the skin, which is more associated with maybe trauma or maybe anticoagulant therapy. But in thrombophlebitis, a blood clot forming within the vein is not really associated with a bruising. And the bruising near the ankle could indicate something else, maybe an injury or a bleeding disorder. So for you to approach this type of question, you need to focus on the inflammation. We are talking about venous inflammation. So think about signs that are locally inflammatory, like warmth, pain, and redness. And you also need to recognize the symptom patterns involving calf pain due to the vein irritation, the warmth, and also the redness. So if you see any other symptom that does not align with vein inflammation, such as claudication or bruising, they're unrelated. So you have to eliminate those right away. Number 11, a healthcare provider orders peak and trough levels for a client receiving an IV antibiotic. At what time should the nurse collect a blood sample to measure the trough level if the antibiotic was administered at 12 p.m.? A, 12:30 p.m., B, 1 p.m., C, 11 a.m., D, 11:30 a.m. So this question is actually wanting you to find out or wanting you to figure out when to draw a trough level sample. And so in the case, the antibiotic was administered at 12 p.m. And the question is asking at what time you should collect the blood sample for the trough level. There's no other answer other than letter D, because the trough level refers to the lowest concentration of the drug in the bloodstream, which occurs just before the next dose is administered. And so to accurately measure this level, the blood sample should be collected within 30 minutes before the next scheduled dose. And since the antibiotic was administered at 12 p.m., the next dose is scheduled for the same day, the next day. So the blood sample should be drawn 30 minutes prior to 12 p.m., which is 11:30 a.m. Now, why is letter A incorrect? Well, 12:30 p.m. is a bit too late for the trough level. So by 12:30 p.m., the drug concentration is starting to rise as the body absorbs and processes the medication. So it won't reflect the lowest concentration anymore. So remember, the trough level is all about measuring the low point, which happens right before the next dose. So if you selected letter B, 1 p.m., take note that by 1 p.m., the drug concentration would still be rising, not at its lowest point. So this timing would be too late as well to capture the trough level, because it's already past the time when the drug concentration should be at its lowest. Letter C, 11 a.m. This is too early to measure the trough level, because around this time, the drug concentration is still rising from the previous dose and won't be at its lowest point yet. And so this is why it's important to wait until just before the next dose, which is at 11:30 a.m. So again, when you are going to answer this type of question about trough level, you have to rethink or recall that the blood draw should be done just before, immediately before the next medication dose, okay? Because we are trying to measure the lowest drug level, okay? So you're going to eliminate the peak timing as well, because we know that peak levels are taken after the drug has been administered and is reaching at its highest concentration, usually 30 minutes after the dose. So Don't confuse this with the trough levels, which are focused on the lowest concentration right before the next dose. Let's have number 12. A client using a meter dose inhaler complains of an unpleasant taste when inhaling the medication. What action should the nurse recommend? A. Brush the teeth before using the inhaler. B. Use a spacer device with the inhaler. C. Suck on a piece of hard candy after inhaling the medication. D. Shake the inhaler longer before use. So, this question is asking you, what should the nurse recommend to address the issue of an unpleasant taste when inhaling the medication? And so the correct approach here is to do letter B, use a spacer device with an inhaler. Now, I want you to recall what a spacer does. Well, the spacer is supposed to be attached to the inhaler itself. It is going to work by capturing larger medication particles that would otherwise settle on the tongue or the mouth. And so when the client uses a spacer, the medication is more effectively directed into the lungs rather than landing on the tongue, which can reduce or even eliminate the unpleasant taste. And so letter A is incorrect. We know that brushing the teeth can be a good intervention to promote oral health, but it's something that should be done after using the inhaler, not before. And brushing the teeth beforehand won't prevent the unpleasant taste during inhalation. We know that this is an intervention that would be beneficial to other reasons, right? It can help prevent fungal infections, which is one of the potential side effects of inhaled steroids. But we are actually talking about preventing that unpleasant taste. So you have to select an option that actually will diminish this kind of sensation. And this is going to be done by the use of the spacer. If you select letter C, suck on a piece of hard candy after inhaling the medication, this might help mask the taste after the inhalation, but it's not going to address the root cause of the issue, which is the taste experience during inhalation. And so letter C is a temporary fix. It doesn't really provide a long-term solution to the unpleasant taste while using the inhaler. If you selected letter D, shake the inhaler longer before use, this can only ensure the medication is properly mixed and dispersed, but it has nothing to do with the taste. Because the taste can occur when the medication lands on the tongue during inhalation, and the shaking of the inhaler doesn't really affect where the medication is deposited in the mouth or the lungs. So when you are trying to answer this question, I want you to identify the client's main concern. That is the taste. The complaint here is about the unpleasant taste during inhalation. So you need to look for the option that directly address how to reduce or how to prevent the taste while inhaling. All right. And also make sure to remember make sure to focus onto the role of the spacer, which is specifically a device that is intended to reduce the impact of the medication on the mouth and the tongue. All right. We have number 13 that will follow through after this one. So we are inviting you to join Stanco's NCLEX coaching today and get access to all this amazing stuff. There's 300 hours of engaging animated video lessons, on-demand videos that you can watch anytime, of course. And there are over 10,000 practice questions. You will be able to get the audiobook and ebook for easy studying. There's also mock tests, computer adaptive tests, and test series to give you a real exam experience, and about 200 plus next-gen NCLEX questions, and all can be accessed in 12 months. All right. So I want you to check the website stankos@nclexcoaching.com to start your path to NCLEX success. Let's have number 13. A 35-year-old client is scheduled for cervical conization to remove abnormal cervical cells and assess the extent of their spread. What behavior would show the nurse that the client has understood the post-op instructions? A. Shows how to change sterile dressings. B. States that her children make her comfortable with the sterility of the procedure. C. Claims she will wait 48 hours before resuming sexual activity. And D. Acknowledges the expected vaginal discharge for 3 to 5 days. Now, I want you to go back into the stem of the question, which is a case of a 35-year-old scheduled for cervical conization, which is a procedure where the abnormal cervical cells are removed and the extent of their spread is assessed. And so the question is, which behavior can show that the client has understood the post-op instructions? Now, the answer here is letter D. Because post-operative vaginal discharge is completely normal after a cervical conization procedure, and the discharge is typically blood tinged and can last anywhere from 3 to 5 days. And it's a result of the procedure's trauma to the cervix as it's trying to heal. And so recognizing and acknowledging this as expected shows that the client understands part of the recovery process. Now, why is letter A incorrect? Well, the conization or the cervical conization does not involve the need for sterile dressings post-op. So the cervix is the area affected, and while there may be a vaginal discharge, the procedure typically does not require any dressings. And so this choice is not relevant to the specific post-op care for this procedure. The same thing with letter B. This statement right in here is it doesn't really address anything related to the post-op recovery process. So sterility during the procedure is important, but after the procedure, it's the recovery and understanding of things like discharge, rest, and activity limitations that matter. And so this option shows misunderstanding of the focus of post-op care. Now let's have letter C. This is also incorrect. Because after cervical conization, sexual activity should be postponed for a longer period, generally until cervix has fully healed, which could take several weeks. And so 48 hours is too short a time for healing, and resuming sexual activity too soon can risk complications such as infection or possibly trauma. Now, I want you to approach this type of question, of course, by focusing on the post-op key concerns. And we're actually going to include about managing vaginal discharge and following instructions about when it's safe to resume activities like sexual intercourse. And so you need to eliminate those unrelated options like dressing changes, which is not a concern after this procedure. Same thing with sterility in letter B. Sterility is already ensured during the procedure, so it's not relevant to post-op care. And so the client also needs to know that healing takes time, especially regarding sexual activity, and 48 hours is too soon for such type of activities. Now let's go into the next item. It's number 14. A nurse is assigning a nursing assistant to care for multiple clients. Which client would benefit most from soaking their feet in warm water for a few minutes during a bath? A client with peripheral arterial disease. B, a client with poor hygiene due to homelessness. C, a client on strict bed rest. D, a client who prefers taking showers. The answer is letter B. Why? Because clients who lack consistent access to hygiene facilities, like those who are homeless can have accumulated dirt and debris on their feet. And so a brief soaking, maybe in warm water, can help soften and also loosen the debris, making it easier to remove without causing skin damage. And it's a gentle approach that prevents excessive scrubbing, which could potentially irritate or harm the skin. Now, why is letter A incorrect? Well, this is something that as letter A is talking about peripheral arterial disease. Well, we know that with this type of disorder, it involves poor circulation, especially in the extremities. So soaking the feet can lead to skin breakdown, infection, worsening circulation issue because of the prolonged exposure to the moisture. And so for these clients, especially in A with a PAD, there should be much careful foot care. Soaking is not advised as it can cause more harm than benefit. Letter C, another incorrect option. A client on strict bed rest generally does not need a foot soaking of the foot because their feet are not exposed to dirt or debris in the same way that someone who is mobile would be. And so their feet likely don't need cleaning in this manner as they're not actively engaging in activities that would soil them. And so soaking would not be particularly beneficial. Now, letter D, a client who prefers taking showers. This is also incorrect. Because they can still clean their feet effectively in the shower without the need for a soak. And while they may prefer a shower, it doesn't necessarily mean their feet require soaking, and there's no indication that their feet are in need of special care in this situation. Alrighty, let's have number 15. A nurse is observing a client using an incentive spirometer. Which actions indicate the correct technique? Select all that apply. A, gradually increases the inspiratory goal each day. B, takes several normal breaths between spirometer use. C, exhales while keeping the mouthpiece in place. And D, inhales slowly and deeply through the spirometer. E, tilts the device while inhaling. This is a select all that apply questions. The options are letters A, B, and D. Why letter A is correct? Well, as the client's lung function improves, they should gradually increase the inspiratory goal. And this also can encourage progressive lung expansion. It can help the client achieve much more optimal lung function over time. And so if the goal is not increased, the client might not be getting the most benefit from using the spirometer. Letter B, another correct answer here, because it's very important to take normal breaths in between using the spirometer to prevent hyperventilation and lightheadedness. And this step also can give the client a break, and it will prevent overexertion. It can ensure that each attempt to use the spirometer is done properly and safely. Letter D, another good option, because the goal of the incentive spirometry is to encourage deep lung expansion, and that requires slow and deep inhalation. All right. Now, why letter C is incorrect? Exhales while keeping the mouthpiece in place. Well, the incentive spirometer is designed to measure inhalation, not exhalation. And so what you should instruct to the patient is to make sure that they remove the mouthpiece before exhaling, because exhaling through the device would not give an accurate reading of the inhalation capacity, which is the purpose of using the spirometer. Letter E is also incorrect because tilting the device while inhaling can affect the accuracy and effectiveness of the spirometer. And take note that the device is designed to be used upright, and tilting could change the flow of air and lead to inaccurate reading. So you should teach the client to keep the device steady to ensure it works properly. Let's have number 16. Which of the following situations would lead the nurse to expect a patient to experience increased levels of nervousness. Choose all that apply. Letter A patient displays signs of consuming too much caffeine. B, a patient is diagnosed with GERD. D, a patient is in the process of alcohol withdrawal. D, a patient's thyroid stimulating hormone reading is 0.03 milliunits per liter. And then we have letter E, a patient has a fasting glucose level of 60 milligrams per deciliter. The correct answers are letters A, C, and D. Why letter A? Because we know that caffeine is a stimulant that can affect the central nervous system by increasing alertness. It can also activate the fight or flight response. And so too much caffeine can trigger symptoms like nervousness, restlessness, can also cause tachycardia and even panic attacks that can mimic anxiety. And so when you're going to consider about caffeine intoxication, this is something that can happen when the intake exceeds 250 milligrams, which is about 2 to 3 cups of coffee. And this can lead to jitteriness, rapid heartbeat, and excessive anxiety. And so this can lead to overstimulation of the central nervous system. Now, why is letter C included? Well, in alcohol withdrawal, this can actually cause an imbalance in the neurotransmitters. It can lead to an overactive nervous system. And since alcohol is a central nervous system depressant, stopping its intake suddenly can cause a rebound hyperactivity of the central nervous system, which can be manifested maybe through a severe anxiety, tremors, agitation, and even seizures. And the manifestations in the alcohol withdrawal can happen within 6 to 24 hours after their last alcoholic drink, and it will peak at around 2 to 4 days. Actually, 24 to 48 hours. So basically a day or two after their last drink. Now, why is letter D included here? We know that, take a look into the reading, 0.03 milliunits per liter. Well, the level here is very low, okay? So the usual normal range is around 0.5 to 5 milliunits per liter. So this basically suggests hyperthyroidism, okay? So a low TSH level suggests hyperthyroidism, which is a condition wherein the thyroid produces excessive thyroid hormones, T3 and T4. And so with excessive thyroid hormones, it can speed up the metabolism. It can lead to palpitations. There's going to be restlessness, irritability, anxiety. And so this is something that you will see in patients with Graves' disease, which is basically an autoimmune form of the hyperthyroidism. And they're going to often report extreme nervousness and panic-like symptoms. Now, why is letter A included? This is a patient with a glucose level of 60 milligrams per deciliter. Well, take note that a low blood sugar level can lead to symptoms like shakiness, sweating, irritability, anxiety. And so when the glucose levels drop too low, the body reacts by triggering this release of the stress hormones like the adrenaline, which can increase the feelings of nervousness. Now, why is letter B incorrect? Well, we know that GERD causes acid reflux and heartburn, which can sometimes mimic chest discomfort or a feeling of distress. But GERD is not a direct cause of increased anxiety. We know that some clients with GERD may also feel discomfort that worsens anxiety, but it is not a primary physiological trigger like caffeine intoxications or maybe alcohol withdrawal or, let's say, hyperthyroidism. And so in order for you to answer this question, I need you to identify first the physiological causes of anxiety. So you need to look for those options where the nervous system is overstimulated or where there is neurotransmitter imbalances that can happen, maybe through caffeine intoxication or maybe alcohol withdrawals, or could be hyperthyroidism. And so you need to eliminate those options that don't directly link to the central nervous system hyperactivity, such as the GERD. All right. So I want you to recognize the common conditions that are associated with anxiety, something like a person that may have intoxication of the stimulants like caffeine, or substance abuse withdrawal like alcohol, and also endocrine disorders such as the hyperthyroidism. Let's proceed to the next item, number 17. A healthcare provider prescribes thigh-high anti-embolism stockings for a client with varicose veins. However, the client's thighs are larger than their lower legs, and the stockings fit the lower leg but cause discomfort and indentation on the upper thighs. What should the nurse do? A. Ask the healthcare provider if an elastic bandage can replace the stockings. B. Change to knee-high stockings as a replacement. And we have letter C. Remove the stockings to avoid causing tissue damage. D. Fold down the top of the stockings below the knees to alleviate pressure. The answer here is letter A. This is the correct choice because an elastic bandage can be adjusted to better fit the client's unique body shape. And since the client has a size discrepancy between the thighs and lower legs, the elastic bandage can provide compression therapy without causing discomfort. So it's a more customizable solution, and it's important to discuss this with a healthcare provider before making changes, as they need to approve any adjustments to the prescribed treatment. And so the incorrect options, such as letters B, C, and D, B here specifically changing to knee-high stockings as a replacement, is incorrect because the nurse cannot make this change independently. So we know that knee-high stockings are a different type of compression therapy, and switching to them would require healthcare provider approval. And so we want to recall here that compression therapy should always be tailored to the client's needs, and the decision to switch stockings should be made by the provider, not the nurse. Letter C is also incorrect because the removal of the stockings completely could increase the risk of complications like venous pooling. And the stockings are prescribed to help manage the client's varicose veins and to promote circulation. And so simply removing them could worsen the client's condition. So it's better to find a solution that allows the client to continue wearing compression without discomfort. If you selected letter D, this is also incorrect because this can create more pressure behind the knees, which may disrupt the circulation, or it can cause discomfort in the area. So instead of alleviating pressure, it could lead to more complications such as obstructed blood flow. So your clues in answering this question, so look for that word discomfort. Okay, so this tells you that the current stockings are not right fit. So you're looking for solutions that involve either adjustments or alternatives to make the stockings more comfortable without compromising the effectiveness of the treatment. And you also have to think about the possible complications. And in a situation like this, you want to focus on options that maintain therapeutic effect, like promoting circulation without causing further harm. And so, for instance, removing the stockings or folding them down could either worsen the problem or it could introduce new risks. So those options are to be discarded as well. Now, In this kind of a case scenario, you need to look for the approval or consultation with a healthcare provider if you're going to alter the treatment, right? So changing the stockings independently is a big no. Okay, you need to consult the healthcare provider first and make sure that this is done right away in order that we are also going to prevent further complications. Number 18. A client with a bundle branch block is being monitored on a cardiac monitor. What ECG findings should the nurse expect to observe? A. Inverted T waves following each QRS complex. B. Prolonged QRS complexes at least 0.12 second. C. Depressed ST segments. And D. Absence of P waves. The correct answer here is letter D, or letter B rather. Why is it letter B? Well, a bundle branch block can cause delayed electrical conduction through the ventricles, which can result in a prolonged QRS complex. And I want you to recall that normally the QRS duration is less than 0.12 seconds, but in bundle branch block, it's going to be widened to 0.12 seconds or more. Now, this delay can occur because the electrical impulses travel through the bundle branches more slowly. And take note that the QRS complex represents the time it takes for the ventricles to depolarize. And when it's widened, it's a clear sign of this conduction delay. Now, if you selected letter A, inverted T waves following each QRS complex, this is incorrect because inverted T waves are usually a sign of cardiac ischemia, lack of blood flow, or maybe myocardial injury. It's not bundle branch block. And the bundle branch blocks don't typically cause changes in the T wave unless there's a coexisting condition like ischemia. So while you might see inverted T waves in certain cardiac conditions, the bundle branch block is not one of them. What about letter C here? Depressed ST segments. This is also incorrect because depressed ST segments are generally a sign of ischemia or myocardial injury. It's not gonna reflect bundle branch block as well. So the ST segment represents the time between ventricular depolarization and repolarization, and ST depression could indicate a lack of blood supply to the heart. But the bundle branch block can primarily affect the QRS complex and does not cause ischemic changes like ST segment depression. What about letter D, absence of P waves? This is also incorrect because in a bundle branch block, the P waves, which represent atrial depolarization, are typically present because the issue lies on the ventricular conduction system, not the atrial rhythm. And so the absence of the P waves would point to a different problem, such as maybe an atrial fibrillation, or could be sinus arrest, but not a bundle branch block. So when you are going to answer this type of question, it is very important that you have to make sure that you understand that a bundle branch block specifically delays ventricular conduction, which directly impacts the QRS complex. So when you see terms like widened QRS or prolonged QRS, you should associate that with a bundle branch block. You have to focus on the QRS duration because it's the main feature here. Now, you're going to also eliminate those options linked to ischemia. Again, take note about the T wave inversion or ST segment depression. These are changes not part of the bundle branch block. And take note that the P waves are also not affected by the bundle branch block. Remember that the P waves are part of the normal atrial rhythm. And in bundle branch block, the problem is specifically in the ventricular conduction. So the P waves will still be visible. Now, let's have number 19. A client with depression is prescribed fluoxetine or Prozac. What should the nurse consider when starting this medication? A. Therapeutic effects may not be evident until 2 to 4 weeks after initiating treatment. B. Regular weekly monitoring of serum drug levels is required for the first 3 months of therapy. And C. Administer the medication with food, such as milk and crackers. And D. Avoid consuming aged cheese, pickled foods, or alcoholic beverages. The answer here is letter A. Well, the situation here is that the patient has been prescribed the Prozac, which is a commonly used SSRI antidepressant for depression. And so the nurse needs to understand how to properly educate and monitor the client when starting this medication. And so with letter A, when the client is starting to take the SSRI, it typically takes several weeks, around 2 to 4 weeks, to experience the full therapeutic effects. The reason for that is because the medication works by increasing the serotonin levels in the brain, and this process takes time to adjust. And it's also important for the nurse to monitor the client's safety during the waiting period, as they might still be at risk for suicide, especially in the early stages of treatment. And so the nurse should emphasize this timeline to the change to manage expectations and maintain patience. Now, why is letter B incorrect, which is regular weekly monitoring of the serum drug levels? Well, this is incorrect because it's not like lithium or maybe other anti-epileptic medications. This Prozac does not require routine monitoring of the serum levels because SSRIs have wider therapeutic windows. So there's no need for weekly blood tests to track drug levels. And the nurse in this scenario does not need to worry about this even when caring for a client on fluoxetine. And this option is more relevant to medications that have a higher risk of toxicity or narrow therapeutic ranges. Letter C is also incorrect because fluoxetine does not require being taken with food to enhance absorption or to reduce the side effects. And in fact, food does not significantly impact how the Prozac is absorbed or how effective it is, it can be effective. And even though it's true that some medications need to be taken with food to reduce stomach irritation, Prozac is not one of those. So there's no need to tell the client to take it with food. What about letter D? Avoid consuming aged cheese, pickled foods, or alcoholic beverages. Again, another incorrect option here. The dietary restrictions, such as this one, is much more intended to those monoamine oxidase inhibitors, the MAOIs, but not SSRIs. And I want you to recall that MAOIs can interact with foods that contain tyramine, like aged cheese, pickled foods, fermented foods, which can lead to dangerous increase in the blood pressure. And the SSRIs, such as the Prozac, do not have this dietary restriction. They don't have this kind of property. And so the client can continue to consume the food items that are mentioned here. Now, it's still important to educate the clients on the potential risk of drinking alcohol while on fluoxetine, as it can increase side effects like sedation or dizziness. But the rest of the food items really are not going to be applicable. So when you are going to answer this type of question, you have to focus on the time frame for the therapeutic effects, such as the SSRIs. They are known to take about several weeks to show full therapeutic effects. So the nurse should expect this delay in the symptom relief. And if they're And if knowing this can also help you pick your answer, which is letter A, since it directly relates to the time frame for the fluoxetine's action. Now you have also to eliminate the options about monitoring or, let's say, dietary restrictions that do not apply to the case. All right. You have to eliminate options that do not apply to the SSRIs. And the monitoring of the blood levels, which is also not applicable because, again, the medication will take about 2 to 4 weeks. Now let's have number 20. After an abdominal hysterectomy, a client returns to the unit with an indwelling catheter. The nurse notices that the urine in the catheter bag has become progressively bloody. What complication might the nurse suspect? A. Disseminated intravascular coagulopathy. B. Relaxation of the uterus causing bleeding. C. Injury to the bladder during surgery. And D. A urinary tract infection due to the catheter. So let's take a look into the situation. This is a client that has returned to the unit after an abdominal hysterectomy with an indwelling catheter in place. So the nurse notices that the urine in the catheter bag is becoming progressively bloody. And so the key here is that the bleeding is specifically in the urine and is happening soon after surgery. So what would be the answer here? The correct answer here is letter C. Because during an abdominal hysterectomy, the bladder is close to the uterus and it is possible for the bladder to be accidentally injured or nicked during the procedure. And this could include maybe scratching the bladder, which could cause bleeding that shows up in the urine bag. And this is a known complication of the procedure. And the bleeding can occur immediately or within a short time after the surgery. So it's essential for you to recognize this complication early to prevent further damage or infection. Now, why is letter A incorrect? DIC. It's because DIC causes bleeding from multiple sites in the body, not just from the urinary tract. We know that the disseminated intravascular coagulation result in abnormal bleeding. It would likely present with widespread symptoms such as bleeding from the IV site, gums, surgical wounds, rather than isolated bleeding in the urinary collection bag. And so it would also likely be accompanied by other clinical signs of coagulation abnormalities, maybe presence of petechiae, ecchymosis, so making this option not the best fit. And why is letter B also an incorrect option? It's because in an abdominal hysterectomy, the uterus is removed. And so once the uterus is surgically removed, it cannot cause post-op bleeding. And we know that uterine relaxation can cause bleeding in other situations, such as a vaginal delivery. It is not relevant here because the uterus is no longer present to be a source of bleeding after the procedure. So uterine bleeding is unlikely. If you selected letter D, another incorrect option, it's because urinary tract infections can cause changes in the urine, such as cloudiness. There's going to be foul odor or even hematuria. However, a urinary tract infection would not typically cause progressive bleeding right after surgery. And so take note here that bleeding that occurs shortly after surgery is more likely due to a surgical injury like the bladder injury mentioned earlier. And so you have to eliminate UTI in this case. Now, your strategy here is to look for the key terms in the questions, such as progressively bloody urine, and the timing of the case. It said here immediately after surgery. So this can help you narrow down the potential causes. And you also have to focus on the surgical complications that are likely to cause bleeding in the urine right after the surgery. Okay. Now, Part of the elimination process here is to identify those options that refer to complications not directly related to the procedure or not likely to cause immediate bleeding in the urine. For example, DIC, which causes widespread bleeding, not just from one organ system. And the uterine relaxation is also irrelevant because the uterus has been removed. Let's move on to our next question, 21. A nurse is caring for a client with osteoporosis who is on a treatment plan that includes exercises, calcium supplements, and daily vitamins. How can the nurse determine that the therapy is achieving its intended outcome? A, the client's heart rate becomes more regular. B, there are fewer bruises than before the therapy. C, the client's mobility improves. D, the client experiences fewer muscle spasm. So the question typically is basically asking how the nurse can determine if the therapy is effective. And the answer to that is letter C, because the primary goals of osteoporosis treatment are to maintain or increase the bone density, to reduce pain, and also to prevent fractures. And the treatment plan, which includes exercises, calcium, and vitamins, is designed to help strengthen the bones and improve mobility as well as to prevent the loss of the bone mass. And with increased mobility, it indicates that the client's bones are becoming stronger and they are less likely to suffer from fractures or pain that could limit their movement. And so if the client's mobility improves, it's a good sign that the therapy is helping to achieve the intended outcome of maintaining the functional movement and reducing bone-related pain. Now, why is letter A incorrect? It's because osteoporosis primarily, the osteoporosis treatments don't directly affect heart rate. And the osteoporosis primarily involves issues with bone density and mineral loss, not heart function. And the treatments focus on the bone health. While exercise can affect cardiovascular health, it won't be the reason for a more regular heart rate. So regularity in the heart rate is not related to this treatment plan. Letter B is also incorrect because bruising is not typically a direct effect of osteoporosis treatment. Vitamin C might help in the cases of capillary fragility or bruising, but the main concern in osteoporosis is the bones, not the skin or the blood vessels. And fewer bruises would not be a direct sign of treatment effectiveness for osteoporosis. Bruising would be more closely linked to a deficiency in vitamins or other conditions, not the treatment for bone density. Letter D is another incorrect option because muscle spasms are generally not the primary issue addressed in osteoporosis treatment. And take note that osteoporosis involves bones, not directly the muscles. And take note that we know that calcium supplementation can help with muscle function. But muscle spasms are more commonly associated with issues like hypocalcemia rather than osteoporosis. Okay. Now we have number 22. A nurse is teaching a client with difficulty swallowing how to eat safely. Which recommendations should the nurse provide? Select all that apply. A, drink fluids while eating solid foods. B, reduce distractions during meals. C, check the mouth for food after eating. D, keep food at the front of the mouth while chewing. And E, tilt the head back when swallowing. So the goal in this question is to minimize the risk of aspiration, which can lead to complications like choking or pneumonia. And so the correct options here are letters B and C. Why letter B? Because this is the recommended technique in reducing distractions. It will allow the client to focus entirely on the task of eating and swallowing. Because if a person is distracted, they might not chew thoroughly or pay attention to swallowing, which can increase the likelihood of food going down the wrong way. And by keeping the patient's environment calm and quiet, the client can concentrate on proper swallowing and lowering the risk of aspiration. Letter C is another good option. Because after eating, it's important to check the mouth to ensure that all food has been swallowed. And take note that any leftover food that's stuck in the mouth or in the throat can later be aspirated. It can lead to choking and aspiration pneumonia. And so ensuring that the mouth is clear can reduce the chance of food lingering in the mouth and potentially entering the airway. Now, why is letter A incorrect? Drink fluids while eating solid foods. It's because drinking fluids or liquids while eating solid foods can also wash the solid foods into the airway more easily, especially if the client already has a problem in their swallowing. Letter D is also incorrect because it's safer to position the food toward the side and the back of the mouth for proper chewing and swallowing. And keeping the food at the front of the mouth may make it harder to chew properly and can increase the risk of choking or aspiration. Take note that the back of the mouth allows the food to be swallowed more efficiently and safely. What about letter E? Tilt the head back when swallowing. This is a big red flag. This is incorrect because tilting the head back can actually increase the risk of aspiration. It could cause the airway to open. It can cause the food to move readily into the open airway, and it will make the swallowing less controlled. So generally, in a patient with a difficulty swallowing, it is recommended for them to tilt their head slightly forward when swallowing, which can help them guide the food into the esophagus and also reduce the risk of food entering the airway. And this technique can also close the airway. So, your approach in answering this question is to focus on the primary goal, which is to prevent aspiration. So always look for the recommendations that help the client to swallow the food safely and to prevent food from entering the airway. And also make sure that you eliminate those other choices that increase the aspiration risk. Now let's have number 23. A nurse is assessing a client for symptoms related to abnormal potassium levels rather. Which clinical manifestations are common to both hypokalemia and hyperkalemia? Select all that apply. A, irregular heart rhythms. B, disorientation. C, queasiness. D, enhanced bowel activity. E, muscular weakness. This is a select all that apply, so you will have multiple answers. We have letters A, C, and E. Why is letter A common in both? Well, take note that both hypokalemia and hyperkalemia can lead to irregular heart rhythms or arrhythmias. Remember that potassium is essential for maintaining the electrical balance across the cell membranes, especially in the heart muscle cells. And so when the potassium levels are either too low or too high, it can disrupt the electrical impulses that regulate the heart, leading to the arrhythmias. So whether the potassium levels is too high or too low, irregular heart rhythms are a common manifestation. Letter C, queasiness. Yes, both conditions can result in nausea. Because with hypokalemia, the lack of potassium can slow down the gastrointestinal motility. It can lead to the discomfort and nausea. On the other hand, hyperkalemia can increase the gastrointestinal activity, which can also cause nausea. So the gastrointestinal symptoms in both conditions share the common symptom of queasiness or nausea, even though the underlying mechanisms are different. We have letter E, muscular weakness. This is another correct option because potassium is a key player in muscle contraction and nerve function. And take note that both hypokalemia and hyperkalemia disrupt the process, leading to muscle weakness. And remember that with low potassium, muscle contractions become weaker, leading to fatigue and weakness. And similarly, the high potassium can also disrupt the muscle function, also resulting in weakness, whether it's too low or too high. Again, muscle weakness is a shared manifestation. Why is letter B incorrect? Disorientation. This is something that is specifically associated with hyperkalemia, not a typical symptom of hypokalemia. Well, the reason for that is because in hyperkalemia, the excess potassium interferes with the nerve function, which can lead to neurological symptoms such as confusion or disorientation. However, in hypokalemia, it may cause fatigue, muscle cramps, or arrhythmias. Letter D, enhanced bowel activity, is incorrect because this is associated with hyperkalemia rather than hypokalemia. So when the potassium levels are too high, it stimulates the gastrointestinal smooth muscles, increasing the bowel activity, which can lead to symptoms like diarrhea or hyperactive bowel sounds. So in contrast, hypokalemia usually decreases bowel activity. It can lead to constipation, abdominal distension, but not enhanced bowel activity. Let's move on to our next question, number 24. A pregnant woman in active labor is admitted to the birthing unit. She is excited as she anticipates the birth of her baby girl confirmed by amniocentesis. Which aspect of her medical history should alert the nurse to potential risk for a complication in the newborn? A. She took NSAIDs regularly for recurring sinus headaches. B. She experienced placenta previa in a previous pregnancy. C. Her membranes ruptured 2 hours ago. D. Her first child was diagnosed with hemophilia. So, just to quickly review what the question is all about, you need to evaluate the woman's medical history to determine any potential risks for complications in the newborn. And the answer is letter A. Why is letter A very crucial? Because NSAIDs like ibuprofen or aspirin during pregnancy can be harmful to the fetus because these drugs are associated with complications such as fetal renal dysfunctions. It can affect the fetal kidneys, leading to poor urine production and amniotic fluid problems. It can also lead to premature closure of the ductus arteriosus, which is that blood vessel in the fetus that is supposed to remain open until after birth, allowing the blood to bypass the lungs while they are still developing. The NSAIDs can cause this vessel to close prematurely, which could lead to neonatal respiratory distress after birth. Another complication is increased bleeding tendencies because NSAIDs can impact platelet function and also clotting. It can lead to bleeding risk for the newborn. So, letter B, incorrect option here. She experienced placenta previa in a previous pregnancy. We know that placenta previa is a serious condition. It only affects the current pregnancy if it recurs. If the woman had placenta previa in a previous pregnancy but not in the current one, it would not be relevant to this pregnancy's risk factors. So this history does not really automatically alert the nurse to a risk for complications in this case. Letter C, another incorrect option here. Membranes ruptured 2 hours ago. This is incorrect because rupture of membranes before labor can increase the risk of infection, but it is not a direct risk for neonatal complications unless it's been longer than 24 hours, which is when the risk of infection becomes more significant. So 2 hours is relatively early, and at this point there is no immediate indication of harm to the newborn unless other signs of infection appear. So this doesn't really point to an immediate risk. All right, let's have letter D. Her first child was diagnosed with hemophilia. Letter D is also incorrect because hemophilia is an X-linked disorder which primarily affects male children. And since the current pregnancy is for a female baby, hemophilia would not affect her unless she's a carrier of the gene, which is unlikely to manifest as hemophilia itself. Thus, hemophilia in the first child does not pose a direct risk for the complications in this pregnancy for a baby girl. So I want you to approach this question by focusing on the medication history. And the key clue here is the use of the NSAIDs during pregnancy, while the other options reference important factors. They either don't apply to this current pregnancy or the risk is not immediate. Now, I want you to eliminate the unrelated risk as well, such as the previous placenta previa and the hemophilia in letter D. They're not directly related to the current pregnancy, especially since the current pregnancy involves a female baby. And lastly, the rupture of the membranes that's mentioned in letter C. It's within a short time frame, 2 hours, does not typically pose an immediate risk for the newborn. And also, I want you to look for the direct risks to the neonate since the question asks about complications in the newborn. So it's crucial for you to focus on any medications or conditions that might directly affect the baby. And so the NSAIDs that have been reported to be irregular medications are clearly associated with the risks like fetal renal issues and respiratory distress, which makes option A the best choice. Let's have number 25. A nurse notices that a client on antipsychotic medication has developed jaundice after 2 weeks of therapy. The nurse continues administering the drug until a healthcare provider is consulted. What should the nurse conclude? A. The blood level of antipsychotics must be maintained once established. B. Jaundice is a benign side effect of antipsychotics that has little significance. C. The prescribed dose of the antipsychotic should be reduced by the nurse. D. Jaundice is sufficient reason to discontinue the antipsychotic. The answer is letter D. Why? Because jaundice in itself is a significant red flag and could indicate liver toxicity, which is a potentially severe and life-threatening side effect or adverse effect of some medications, including antipsychotics. And again, antipsychotic meds can lead to hepatic dysfunction, leading to jaundice, which is basically the yellowing of the eyes or the skin. And this is a serious condition that can indicate liver damage. And the best course of action is to discontinue the medication immediately and consult with a healthcare provider for further evaluation. And so continuing the medication could worsen the liver damage, which is why stopping it is the safest and most appropriate step. Now, why are letters A, B, and C incorrect? Well, take a look first on letter A. The blood level of antipsychotics must be maintained once established. This is incorrect. We know that it's important to monitor the blood levels of antipsychotics in some situations. Maintaining these levels is not the priority when there is a sign of liver toxicity like jaundice. That's a huge red flag. So if the liver damage is suspected, the medication should be discontinued right away. And maintaining the blood levels would not address the potential liver issue. The nurse here needs to stop administering the drug and not continue or adjust the dose. Letter B is also incorrect. It stated benign side effect of antipsychotic that has little significance. Big incorrect option. Jaundice is not benign. It can be a serious sign of liver damage. We know that some medications can cause minor side effects, but jaundice in this context signals a potentially severe problem. Again, the nurse needs to stop administering the medication. All right. So if you're just describing the jaundice here as benign, it could delay proper care and it can result in worsening of the complications. Now, letter C, the prescribed dose of the antipsychotic should be reduced by the nurse. Another incorrect option, because reducing the dose would not be adequate to address liver toxicity. So when you are suspecting liver toxicity, the medication should be discontinued entirely, not just reduce. And again, just reducing it may not be enough to prevent further damage to the liver, and the nurse should stop the medication and notify the healthcare provider for further evaluation. So I want you to approach the CES question by focusing on the key symptoms, keywords such as jaundice. After 2 weeks of therapy, take note of that. That's a potential hepatic dysfunction, which is a serious complication. All right. And I want you to also eliminate answers that downplay the severity. So jaundice should never be seen as benign or unimportant. So discard any answer choice that minimize its significance. Another thing is dose reduction in letter C. It's not enough when liver damage is already involved. So you need to think about discontinuation of the medication entirely. So for you to answer this question correctly, look for the safest action. And in this case, that is going to be letter D, discontinue the medication. And that would be the most appropriate response. So focus on what needs to happen to prevent further harm to the liver and the client's overall health. So this time I'm inviting you to enroll to the NCLEX course and visit Stanco's NCLEX coaching for more details. The question here is, a client with left ventricular heart failure is prescribed 0.25 milligrams of digoxin daily. What signs should the nurse expect if the medication is working as intended? Select all that apply. A, reduced heart murmur. B, jugular vein distension. C, increased urinary output. D, fast heart rate. E, reduced swelling in the legs. F, slower heart rate. The answers are letters C, E, and F. So let's go back into the question stem. The task here is for you to look for the signs to know if the medication, specifically digoxin, is working. And so you have to select all that apply. So one of the correct options here is letter C, increase urinary output. Well, why is this correct? Well, digoxin has a positive inotropic effect, which means it strengthens the contraction of the heart muscle by improving the heart's ability to pump blood. It's going to help increase the renal blood flow, which in turn promotes urine production. We call that as diuresis. And why is this happening? Because in heart failure, poor circulation can cause fluid retention and edema. And by improving the heart's pumping ability, digoxin can help to eliminate excess fluids through increased urinary output. Letter E is also correct. Reduce swelling in the legs. Because of the improvement in the cardiac output, it will also result in better circulation, which can help reduce the edema, which is swelling in the legs, especially the other parts of the lower extremities. And take note that with improved heart function, the blood is pumped more efficiently. It can reduce the fluid buildup that causes swelling in the legs and other parts of the body. Another correct option is letter F, slower heart rate. It's because digoxin has negative chronotropic effect. It simply means that it slows the heart rate by increasing the vagal tone or the parasympathetic stimulation and reduce the conduction speed through the AV node. And why is this a therapeutic effect? Well, in heart failure, a fast heart rate can strain the heart further. And by slowing the heart rate, digoxin allows the heart to fill more fully and pump more efficiently with each beat. Now let's get into the incorrect options, such as letter A, reduced heart murmur. This is incorrect. Take note that the digoxin improves cardiac output, but it does not directly affect the presence or severity of a heart murmur. And a heart murmur is typically related to heart valve problems or structural abnormalities, which digoxin does not treat. And the goal of digoxin therapy is to improve heart efficiency, not address valve-related issues directly. And so a murmur would require further investigation for its underlying cause. Let's have letter B, one of the incorrect options here. This is because jugular vein distension is a sign of right-sided heart failure, not left-sided heart failure. And it occurs when the blood backs up into the veins due to the heart's inability to pump effectively. And of course, jugular venous distension is not a sign of improvement. It's a sign that something bad is progressing. Venous distension in the neck area simply means that there is congestion of blood in the venous system. All right. So this is not a therapeutic effect that you should select in this question. Now, what about letter D, fast heart rate? Yes, that's also incorrect because digoxin is intended to slow the heart rate, not speed it up. It does this by increasing the force of contraction and improving the efficiency of the heart. So if you select fast heart rate, basically tachycardia is typically a sign of poor cardiac output. But digoxin works by slowing the heart rate to give the heart rate more time to fill and pump more efficiently. So tachycardia is not expected with digoxin therapy. Now, I want you to strategize in answering this question. You have to focus on digoxin's key effects. Again, one is strengthening the heart contractions. That is what we call as positive inotropic effect. Another is slowing down the heart rate. This is what we call as negative chronotropic effect, and also to improve the heart's overall efficiency. So when you think of what to look for with successful therapy, think about signs of improved cardiac output like reduced edema, increased urinary output. And the key signs of improvement would include better circulation and fluid elimination. Now, another strategy here is to eliminate those unrelated symptoms, such as the jugular venous distension and the heart murmur. Don't directly correlate with what digoxin does. Again, digoxin won't affect a murmur or resolve right-sided heart failure as indicated by the JVD. So these options can be eliminated. And the same thing as the fast heart rate, it goes against the action of digoxin. So make sure that you remember the goal of treatment, which is basically improving the heart efficiency. Let's move on to the next item, number 27. Nurses caring for a client recently diagnosed with diabetes. Which of the following nursing interventions focuses on self-management in the affective domain? A, educating the client on foods high in glucose. B, guiding the client in self-administering insulin. C, providing a list of signs and symptoms of high blood sugar. D, encouraging the client to share emotions about their new condition. So the question here is asking you which nursing interventions to focus on supporting the client's emotional and behavioral aspects of self-management. And the answer here should be letter D, because this intervention is rooted in the affective domain of learning. And remember that affective domain deals with emotions, attitudes, values, and feelings. So encouraging a client to express their emotions can help them process and cope with the emotional aspects of living with a new diagnosis, which is a key part of self-management. And why is this important? It's because in diabetes, self-management, it's just as important to address the emotional response to the diagnosis. For example, fear, anxiety, anger, as it is to teach about the disease itself. So the emotional aspect is vital for long-term coping and the compliance to the treatment. Keep that in mind. Now, the other options such as A, B, C are all incorrect. A specifically, it's because this intervention in A belongs to the cognitive domain, which involves intellectual understanding and knowledge acquisition. And take note that teaching the client about foods high in glucose is more about knowledge and understanding how certain foods affect blood sugar levels. So this is intellectual learning, not emotional learning. So it's part of the cognitive domain. Letter B is also incorrect because this intervention falls into the psychomotor domain, which focuses on the development of physical skills and action. So an example would be learning to self-administer insulin, or maybe handling syringes and understanding that technique for injecting the insulin. So this is skills-based learning, and psychomotor learning is the key here. Again, this is to be discarded. Letter C, another incorrect option. This is another example of the cognitive domain. It involves providing factual information about how to recognize symptoms of hyperglycemia. So like the first option, providing factual knowledge about symptoms is about understanding the disease and managing it through intellectual learning, not through emotional engagement. So your strategy here is to recall the three domains of learning. We have the cognitive domain, which deals with the knowledge and understanding by giving them the facts, the concepts, information. The second one is psychomotor domain, which involves physical skills and manual skills like administration of the insulin, self-administration, taking their blood pressure. And lastly, we have affective domain, which relates to emotions, values, attitudes, and beliefs, or maybe coping with a diagnosis and sharing with feelings. And our last strategy here is to identify the domain in the question. And again, the question specifically asks for an intervention in the affective domain, which means it's looking for an answer that addresses emotions, feelings, and attitudes. Let's have number 28. A pregnant woman arrives for her first prenatal appointment. She has had a 2-year-old son born at 40 weeks, a 5-year-old daughter born at 38 weeks, and 7-year-old twin daughters born at 35 weeks. She also had a spontaneous abortion at 10 weeks 3 years ago. Using the GTPAL system, what would be the appropriate documentation for her obstetric history? A, G5T2 P2 A1L4, B, G5T2 P1 A1L4, C, G4 T3 P1 A1L4, and D, G4 T3 P2 A1L4. The answer is letter B. So let's break this down. The G stands for the total number of pregnancies a woman has had, including the current one. And the T stands for the number of term births, including the deliveries at 37 weeks or later. We have P, which stands for the number of preterm births. So this includes the deliveries between 20 and 37 weeks. And we have A, which stands for the number of abortions, spontaneous or elective, before 20 weeks. And L stands for the number of living children. And so the correct answer is letter B. Take note that the client in this case has had 5 pregnancies in total. This includes her current pregnancy plus her previous 4, the 3 live births and 1 abortion. T2, it's because she has had 2 term births, which were the 2-year-old son born at 40 weeks and the 5-year-old daughter born at 38 weeks. P1 is the answer here also. It's because she has had 1 preterm birth, which was the birth of her twin daughters at 35 weeks. Note that twins are counted as 1 pregnancy and 1 preterm birth, even though she delivered 2 babies. Now, A1, of course, because she has had 1 abortion, which was the spontaneous abortion at 10 weeks. And lastly, L4, she has 4 living children, her son and 3 daughters. The twin daughters count as 2, but they're part of the same birth, so only 1 living event is counted. So option B is the correct representation of her obstetric history. Now, what about letter A? This is incorrect because this option mistakenly counts the twins as 2 preterm births. But in the GTPAL system, the birth of twins at 35 weeks counts as 1 preterm birth, not 2. C is also incorrect because this option reflects 4 pregnancies instead of 5. The woman has had 5 pregnancies, including the current one, so this is not the correct choice. Letter D is also incorrect. Again, this option counts the twins as 2 preterm births, which is incorrect. The twins should only count as 1 preterm birth in the GTPAL system. Let's have number 29. A client has been receiving fluphenazine for several months. Which of the following should the nurse assess the client for? Select all that apply. A, reluctance to converse. B, minimal use of nonverbal expression. C, uncoordinated movement of extremities. D, tremors, excessive salivation for E, and F, rambling speech. The answers are letters C and D. Now, take note that your task in this question is to identify the potential adverse effects or symptoms that should be addressed in a client who has been taking fluphenazine for several months. And so letter C is one of the correct options here because the uncoordinated movements such as tremors are a classic sign of extrapyramidal symptoms. We call them as EPS, which can occur with fluphenazine, which is a typical antipsychotic medications. And the EPS are motor symptoms that arise as adverse effects of these drugs, and this includes rigidity and dyskinesia or involuntary movements, tremors, and uncoordinated extremity movement is an early sign of EPS, and it's important for the nurse to assess for these symptoms regularly, especially in long-term use of antipsychotic medications. We have letter D, tremors are another common extrapyramidal symptom associated with the fluphenazine, particularly when used over a long period. And the tremors can present in the hands, the fingers, or other parts of the body, and often seen in patients who have been on typical antipsychotics for a prolonged time. So it's important for the nurse to monitor for any involuntary movements as they indicate that the client may be developing EPS, which may require interventions or medication adjustments. And so the rest of the options here, we have letters A, B, E, and F are all incorrect. Letter A, which is the reluctance to converse, it is not a adverse effect of fluphenazine, while it might seem relevant, but the reluctance to talk could be related to the client's underlying conditions, such as the schizophrenia. And people with schizophrenia might show social withdrawal or a lack of communication, but this is more about the mental health condition itself rather than a direct side effect or adverse effect of the medication. B is also incorrect because minimal use of nonverbal expression could be seen in clients with schizophrenia, but again, it's not a fluphenazine adverse effect. It might be related to the patient's mental health state rather than the antipsychotic medication. And this is more of a symptom of the condition being treated rather than a medication related issue. Letter E, excess salivation is not typically associated with fluphenazine. Well, in fact, the opposite, which is dry mouth or reduced salivation, is more commonly seen with antipsychotic medications, especially with typical antipsychotics like fluphenazine. So if the patient was complaining of dry mouth, that would be a more expected adverse or a side effect. And we have letter F right here, rambling speech is also not a typical side effect or even an adverse effect to fluphenazine. Instead, this symptom is maybe more directly related to the exacerbation of schizophrenia or other psychiatric issues, but it is not something that would usually occur due to the fluphenazine therapy. Now, I want you to take on the keywords in this question, or let's say the words in the options itself. So you need to notice the words like uncoordinated movements, tremors. These are key red flags for extrapyramidal symptoms, which are directly associated with the use of the typical antipsychotics. And the EPS, again, involves motor side effects or motor adverse effects like tremors, rigidity, and coordinated movement. So those should immediately signal you to select answers that describe these types of symptoms. Now, you also need to eliminate those non-relevant symptoms unrelated to the antipsychotic adverse effects. So, for example, reluctance to converse in rambling speech, which are more likely related to the mental health condition itself rather than a medication adverse effect. All right. Let's move on to number 30. 2 hours after a cardiac catheterization accessed via the right femoral artery, the client complains of numbness and pain in the right foot. What should the nurse prioritize? A, assume that this is a normal response. B, measures the client's blood pressure. C, notify the healthcare provider immediately. And D, assess the client's pedal pulses. The answer is letter D. Well, let's go back into the question stem. It's asking you to prioritize an action in response to a client's complaint of numbness and pain in the right foot 2 hours after a cardiac catheterization accessed via the right femoral artery. Why letter D? Well, the numbness and pain in the right foot after a femoral artery catheterization could be indicative of compromised blood flow to the lower extremity. And one possible complication after femoral artery access is the formation of a clot, a thrombus, which can block the circulation and will impair perfusion to the foot. It can lead to symptoms like numbness and pain. And assessing the pedal pulses is a priority because it provides an immediate critical information about the blood flow to the area. And the absence of pedal pulses could suggest that the blood supply to the foot is inadequate, which requires prompt action to prevent further complications such as tissue damage or ischemia. Now, the next question here is why this is the priority. Well, the nurse needs to gather data on the circulatory status of the foot before making any other decision. So if the pulses are absent, the nurse may need to take immediate action to restore circulation, such as notifying the healthcare provider or taking measures to treat the clot. But first, assessing the pedal pulses is the essential first step. Now, why are the letters A, B, C are all incorrect? Well, A, assume that this is a normal response. Well, the symptoms of numbness and pain are not typical. And of course, following a cardiac catheterization, especially if the procedure was done via the femoral artery, after the procedure, some discomfort or bruising might occur, but persistent numbness and pain, particularly in the foot, could signal a circulation problem. And so if you're assuming it's normal response, could delay identifying a serious complication such as a clot or a reduced blood flow, and that could delay harm. That delay could actually harm the patient. Now, what about letter B? Measure the client's blood pressure. Well, we know that this is important to monitor the blood pressure, right? But this would not be the nurse's first priority in this situation. The numbness and pain are likely caused by a local circulation issue in the foot rather than a systemic problem like hypotension. And so the nurse should assess first the local circulation via pedal pulses before considering a broader systemic issue. And take note that blood pressure monitoring could come after confirming circulation status in the foot. Letter C is also incorrect. We know that notifying the provider might indeed be necessary if the nurse detects a problem, but it should come after assessing the pedal pulses. The nurse must first gather the information about the client's circulatory status, and if the pedal pulses are absent or weak, then notifying the healthcare provider becomes the next step. However, without assessing the pulses, the nurse might not have enough data to explain the situation to the healthcare provider accurately. So I want you to strategize your approach in answering this question. So you need to look for the keywords in the questions like numbness, pain, right foot, femoral artery. So these suggest a local issue potentially related to the blood flow or circulation in the right foot, which is the area accessed through the catheterization. And also that knowing that the problem is likely vascular due to the femoral artery, your first instinct should be to assess the local circulation, which is done by checking the pedal pulses. Now, another strategy for you to use is to eliminate options that don't address the root cause. So for example, option A, assuming it is a normal response, can be eliminated right away because it overlooks the potential seriousness of the symptoms. Same thing with letter B. Measuring the blood pressure can be ruled out because the issue seems localized to the foot, not systemic. And letter C, notifying the healthcare provider is important, but it's not the first step. The nurse needs data first. Pedal pulses will provide that data. So the key to this question is prioritization. What needs to be addressed first? And again, there is a local circulation problem, like impaired blood flow to the foot. This needs to be addressed before general monitoring, like blood pressure checking, or let's say contacting the provider. So again, pedal pulses are the quickest, most direct way to assess this issue in this situation. Let's have number 31. A nurse is administering a lozenge to a client by placing it in the buccal area. Which actions are appropriate? Select all that apply. Letter A, positioning the lozenge under the tongue. B, placing the lozenge on the same cheek each time. C, administering the lozenge before meals. And D, ensuring the client remains awake while it dissolves. And E, advising the client to take occasional sips of water. It's a select all that apply. But take a look into the answer to this question. The answer is only letter D. Why? Because when a lozenge is administered in the buccal area between the cheek and the gum, it is essential to keep the client awake to ensure their safety. And recall that a lozenge needs time to dissolve slowly. And if the client falls asleep, there is a risk for accidental aspiration where the lozenge could be inhaled into the airway, could potentially block it. And so by keeping the client awake, the nurse is preventing this dangerous situation and allowing the lozenge to dissolve properly. Now, why is letter A incorrect? Positioning the lozenge under the tongue. This is incorrect because this is a classic sublingual administration method, not buccal. And again, with the sublingual medications, these are going to be placed under the tongue where they're going to dissolve and are absorbed quickly through the mucous membrane. But in this case, we're talking about buccal lozenge, which should be placed between the cheek and the gum, not under the tongue. So this answer is incorrect because it mixes up the two routes of administration. Letter B is incorrect because it's generally better to alternate cheeks when administering a buccal lozenge. This is going to help prevent the irritation of the mucosa, which could become sore if the lozenge is placed in the same spot repeatedly. And so by switching sides, you allow the buccal mucosa to recover and minimize discomfort. So placing it on the same cheek each time is not the best practice. Letter C is incorrect because it's typically recommended to administer lozenges either after meals or between meals. And the reason for that's because a lozenge before a meal could interfere with digestion or affect the absorption of nutrients, such as the lozenge might coat the mouth and the throat, potentially making it harder to swallow food or fluids. So this answer is incorrect because it doesn't align with the typical recommendations. Now, letter E is also incorrect. Why? Because when using a lozenge, it's generally advised to avoid drinking fluids immediately. We know that sipping water can interfere with the effectiveness of the lozenge because it might wash it away too quickly before it has had time to dissolve and be absorbed. And in addition to that, drinking while the lozenge is dissolving, it could increase the risk of aspiration, especially if the client is not fully alert. So sipping water could make the situation riskier and less effective. So again, the strategy for this, in answering this question, is to take note of the key term, buccal administration. Always consider the proper technique and safety measures specific to this method. All right, let's have number 32. A pregnant woman asks a nurse about the effects of smoking on her baby. What response from the nurse is most accurate? A, chemicals in smoke cross the placenta and harm the fetus. B, the placenta protects the fetus from the effects of smoking by blocking these chemicals. C, smoking reduces maternal stress, which is beneficial to the fetus. And D, smoking causes narrowing of blood vessels in both the mother and fetus, which can harm both. The answer is letter D. Why? Because smoking during pregnancy causes vasoconstriction or narrowing of the blood vessels in both the mother and the fetus. And this can significantly reduce the blood flow, which means less oxygen and less nutrients are delivered to the fetus, which and also reduce oxygenation and nutrient supply can lead to restriction of the fetal growth. It can lead to preterm birth and a higher risk of infant mortality. And this question is also correct because it focuses on the physiological effect of smoking, which directly harms both the mother and the baby. Now, why is letter A incorrect? We know that it's true that some chemicals in smoke can cross the placenta, but this option oversimplifies the problem. The primary issue isn't about just the chemicals crossing over, but the vasoconstriction that affects both maternal and fetal circulation. It is the lack of oxygen and the nutrients reaching the fetus that leads to complications, not just the diffusion of the harmful substances. So while this option is not entirely wrong, it misses the most critical impact of smoking, which is reduced oxygenation. Letter B is also incorrect because the placenta does act as a barrier, but it does not fully protect the fetus from harmful substances. In fact, some harmful substances like nicotine and carbon monoxide can cross the placenta and will reach the fetus, causing damage. So this answer is incorrect because it falsely implies that the placenta offers complete protection, which is not the case. Now, what about letter C? This is also incorrect, but is also misleading. Smoking does not reduce maternal stress. In fact, it increases stress and presents numerous health risks to both the mother and the fetus. It will lead to higher levels of the stress hormones like cortisol, and it also increases the risk of complications such as preterm labor and placental abruption. So claiming smoking has any beneficial effects on stress is a misconception. So you need to understand the key concepts. We have to remember about the physiological effects of smoking, which is vasoconstriction, and the limitation in the amount of oxygen and nutrients reaching to the fetus, which can lead to potential growth issues and other complications. So you have to keep in mind, make sure that you eliminate those answers that don't address the core issue. Let's have number 33. When assessing a client's rhythm via cardiac monitor, what findings are used to confirm normal sinus rhythm? Select all that apply. A. QRS duration between 0.12 and 0.2 seconds. B. RR intervals remain consistent. C. Every QRS complex is preceded by a P wave. And D. The SC segment is elevated above the PR interval. And E. 4 to 8 complexes are present within a 6-second strip. The answers are letters B and C. So let's rephrase the question here, or let's understand really what it's asking. So the question is asking you to identify the characteristics that confirm a normal sinus rhythm when assessing the client's rhythm in the cardiac monitor. So for you to successfully do it, you need to recognize first the typical features of the normal sinus rhythm, and then choose the finding that match those features. And so let's look into letter B. RR intervals remain consistent. So this actually represents the time between two successive R waves on the ECG. And in normal sinus rhythm, the rhythm is regular, meaning that the RR intervals are consistent. And this indicates that the heart is firing from the same point, the sinoatrial node, and maintaining a very steady rhythm. So consistency in the RR intervals is a key feature of normal sinus rhythm. Now we have letter C. Every QRS complex is preceded by a P wave. Yes, the presence of a P wave before every QRS complex is another hallmark of normal sinus rhythm. It simply means that the electrical impulse is originating from the SA node, which is the natural pacemaker of the heart. And in normal sinus rhythm, this is a consistent pattern as each impulse is properly initiated in the SA node, and it travels through the atria and then to the ventricles. So the normal sinus rhythm, so for the normal sinus rhythm, each QRS complexes should follow a P wave rather. Now the other options here, letters A, D, and E, are all incorrect. For letter A, it said here QRS duration between 0.12 and 0.2 seconds. So this is incorrect because the QRS duration should be less than 0.12 seconds in the normal sinus rhythm. And so when the QRS duration is greater than 0.12 second, this can suggest a conduction abnormality, maybe a bundle branch block. So this option is incorrect because it suggests prolonged QRS duration, which is not a characteristic of normal sinus rhythm. Now, what about letter D? ST segment is elevated above the PR interval. This is incorrect, right? This statement is not related to the diagnosis of normal sinus rhythm. The ST segment should be isoelectric, meaning flat, and elevation of the ST segment is a key sign of ischemia, or let's say myocardial injury. It is not a normal finding. Now, the PR interval, it said here, ST segment is elevated above the PR interval. The PR interval is a measure of time from the onset of the P wave to the beginning of the QRS complex, and it has no direct correlation to the ST segment's elevation, so this option is going to make it incorrect. Now, what about letter E? 4 to 8 complexes are present within a 6-second strip. Another incorrect answer, because this refers to the heart rate calculation, which can be estimated by counting the number of QRS complexes in a 6-second strip and multiplying by 10. While this method is useful for calculating the heart rate, it is not specifically used to confirm normal sinus rhythm. This might be a helpful tool, but it does not directly confirm the rhythm itself. So you have to focus on the key features of the normal sinus rhythm. You need to have that consistent RR intervals and the presence of the P wave before each QRS complexes, or each QRS complex rather. Let's have number 34. A client with Crohn's disease is prescribed parenteral vitamins. Why are these vitamins administered intravenously rather than orally? Select all that apply. A, intestinal absorption may be impaired. B, allergic reactions are less likely. C, they act more quickly when given IV. And D, oral administration is ineffective. And E, they help reduce inflammation in the colon. The answers are letters A, C, and D. A is correct because one of the hallmark features of Crohn's disease is the inflammation and the damage to the gastrointestinal tract, particularly the small intestine. And this can lead to impaired absorption of the nutrients, including vitamins. And since the intestines may not be able to absorb oral vitamins effectively, IV vitamins through the IV route are given because they bypass the digestive system altogether, and they are absorbed directly into the bloodstream, ensuring the patient receives the nutrients they need. For letter C is also correct. It's because when vitamins are administered intravenously, they enter the bloodstream immediately, allowing for a much faster effect. And this can be particularly important in managing nutrient deficiencies in patients with Crohn's disease because, again, oral intake may not provide the same level of absorption or speed. So by bypassing the GI tract, IV vitamins can rapidly correct deficiencies. Now, what about letter D here? Oral administration is ineffective. Yes, that's also correct. The oral vitamins are ineffective in patients with Crohn's disease because, again, the intestinal absorption is compromised due to damage from the disease. Even if the patient takes vitamins orally, their body may not absorb them properly. And as a result, this is going to make it ineffective. Now, what about letters B and E? Allergic reactions are less likely and they help reduce inflammation of the colon. Well, B specifically is incorrect because the route of administration does not impact the likelihood of allergic reactions to a medication. And allergic reactions can occur with any form of medication, whether oral, could be IV, or another route. And the risk of an allergic reaction depends on the individual's immune system and sensitivity to the substance, so not the method of the delivery. So this option is not relevant to the reasoning behind the choice of parenteral vitamins. Letter E is incorrect because the vitamins themselves do not have a direct role in reducing inflammation in the colon. While some vitamins like vitamin D may have an indirect effect on the immune function, parenteral vitamins are not specifically given to treat inflammation associated with Crohn's disease. The purpose of administering IV vitamins is to correct deficiencies due to impaired absorption due to the underlying inflammatory process in the bowel. So you have to focus in the core issue, which is the intestinal absorption that is impaired. So take note of that. Remember that about in Crohn's disease. So you have to eliminate those irrelevant options, such as allergic reactions and also reducing inflammation. Let's have number 35. A client in her 37th week of pregnancy is preparing for a non-stress test. After the nurse explains the procedure, which statement shows that the client comprehends the instructions? A, I hope this test does not cause my labor to start early. B, if the heart rate looks good, it means my baby will be fine during labor. C, they will need to put an IV in to give me medication for the test. And D, my baby might get really restless after this test. So let's go back into the question. This is asking you to identify the statement that demonstrates the client's understanding of the instructions regarding the non-stress test. And you need to recall that the non-stress test is a routine prenatal test to monitor the baby's heart rate and response to movement, typically performed in the third trimester to assess fetal well-being. Now, the answer here is letter B. And why is this correct? Well, this is correct because the non-stress test is a procedure used to monitor the fetal heart rate in response to fetal movement. And during the test, the nurse monitors the fetal heart rate with a Doppler and checks for the patterns that suggest fetal well-being. And when there is such a thing like a reactive non-stress test, wherein the fetal heart rate shows normal acceleration with movement, this indicates that the fetus is well oxygenated and has a healthy heart rate, which means it will likely tolerate labor well. And so this statement reflects an understanding that a good non-stress test result suggests fetal well-being, especially in relation to labor. Now, letter A is incorrect because this statement is not because the non-stress test is a non-invasive procedure. It does not involve any medications or interventions that could trigger labor. The test simply monitors the fetal heart rate in response to movement, so there is no risk of it starting labor early. And this statement alone shows a misunderstanding of the procedure, as it does not cause labor to begin. Letter C is also incorrect because there are no medications or IVs that are involved in the non-stress test. It is a monitoring test wherein the fetal heart rate is tracked. It does not require any invasive procedures or medication. And so this statement also reflects misunderstanding of the non-invasive nature of this testing. Letter D is also incorrect because there is no evidence that a non-stress test will make the fetus restless. The procedure simply involves monitoring fetal heart rate in response to the fetal movements, and it does not cause any changes in the body's behavior. And again, another statement that reflects misunderstanding. So your strategy here is to understand the core purpose of the test. You have to recall that. Again, it is a non-invasive procedure. It only focuses on observing how the baby's heart rate reacts to movement. It only will assess fetal well-being through monitoring the heart patterns, especially in response to fetal movement. So keep that in mind when evaluating the answers. 36. A healthcare provider prescribes anti-embolism stockings for a client to wear while out of bed. What important instructions should the nurse provide? A. Slightly roll the top band for comfort. B. Remove and reapply the stockings every 4 hours. C. Massage the legs with lotion before putting them on. And D. Apply them before the legs become dependent. The answer here, it is letter D. The primary purpose of anti-embolism stockings is to improve venous circulation and to prevent blood pooling in the legs, which can help reduce the risk of DVT and pulmonary embolism. And so when a person's legs are in a dependent position, let's say dangling off the side of a bed, the gravity will cause the blood to pool, which will increase the risk of clot formation. And so applying the stockings before the legs become dependent can ensure that the stockings can exert their pressure on the veins to help push the blood upward toward the heart. It also minimizes fluid buildup in the tissues, and it will also reduce the risk of clot formation and other complications. So this is the most important instructions because it directly addresses the preventive benefit of these stockings. Now, if you selected letter A, this is a big, bad, incorrect option because rolling the top band of the stocking can restrict circulation at the top of the leg. Essentially, it will act as a tourniquet. All right. This can interfere with the stocking's ability to promote proper circulation, and even it can cause skin damage or maybe further circulatory issues. And so supposedly the stocking should be applied smoothly without any wrinkles or folds to ensure even pressure and effective functioning. Now let's tackle letter B, remove and reapply the stockings every 4 hours. This is also incorrect, because frequent removal and reapplication of the stockings is not necessary unless there is a specific concern like skin irritation or maybe other circulation issues. And the anti-embolism stockings typically have foot openings that will allow nurses or healthcare providers to assess circulation. And the stockings should be removed for about 30 minutes, 3 times a day, or yes, that's the recommendation. So basically to be removed for about 30 minutes, 3 times daily to give skin a break, not every 4 hours. That's a bit way too much. And so reapplication every 4 hours would be unnecessary and also can interfere with the effectiveness of the stockings. And so this is going to be an impractical recommendation and could also add to the client's discomfort. Letter C, another incorrect option, because this can potentially dislodge a clot if one exists, which could lead to pulmonary embolisms or other complications. And in addition to that, the application of lotion can also increase friction between the skin and the fabric of the stockings, which can cause skin irritation or abrasion. And the goal when you are applying the anti-embolism stockings is to protect the skin and ensure that the stockings are smoothly applied without causing additional friction or harm. Now, let's go into the strategies in answering this question. I want you to understand really the purpose of the stockings application. Okay, again, this is only to promote circulation. by exerting external pressure to the veins, and you have to eliminate actions that can cause harm, such as rolling the top band, which can serve as a tourniquet. All right, this will block off circulation. Massaging the legs can also potentially dislodge clots, so you got to eliminate that as well. And the frequent removal of the stockings is unnecessary and could interfere with the effectiveness, so eliminate that one as well. Let's have number 37 after this. And so again, we are inviting you to enroll to the NCLEX course via Stancoast, nclexcoaching.com. So get onto that website. Moving on to number 37. A client with schizophrenia is taking benztropine, cogentine alongside an antipsychotic. The client mentions that they sometimes forget to take the cogentine. What should the nurse advise the client to do if this happens again? A, take a dose as soon as possible, up to 2 hours before the next dose. B, skip the dose and then take the next regularly scheduled dose 2 hours early. And C, use 2 pills at the next regularly scheduled dose. And D, notify the healthcare provider about the missed dose immediately. Well, the answer here is letter A. Take note that benztropine or cogentine is an anticholinergic medication that is prescribed alongside antipsychotic medications to manage extrapyramidal symptoms like muscle rigidity, tremors, and other motor side effects. And so in a case if a dose of cogentine is missed, it's very important to take it as soon as possible when the client remembers, as long as it's not too close to the next dose within a 2-hour window. And so this action will help prevent the recurrence of the extrapyramidal symptoms, which can be uncomfortable and debilitating for the client. And taking the dose within this time frame can also ensure that the client remains stable on their treatment regimen without significant interruptions in symptom control. Now let's take a look into letter B. This is an incorrect option because skipping the dose is not a good idea, because benztropine needs to be taken consistently to prevent worsening of the EPS symptoms. And also taking the next dose too early can disrupt the medication schedule, possibly causing a misalignment in the therapeutic drug levels in the client's body system. And it can also risk causing side effects, as it's not advisable to alter the timing of medications drastically without consulting a healthcare provider. Now, letter C is also incorrect. This is a dangerous recommendation, and it could lead to an overdose. And when the patient does this, it can increase the risk of severe anticholinergic effects, such as dry mouth, blurred vision, also urinary retention, or possibly confusion. And doubling the dose is never a recommended strategy and should always be avoided. So if the client misses a dose, the correct response is to take the missed dose soon after, remembering never to take multiple doses. Now, letter D, notifying the healthcare provider immediately is also incorrect. We know that it's important to keep the provider informed about any medication issues, but there is no need for immediate notification about a single missed dose unless the client experiences significant problems or maybe side effects. The primary action the nurse should advise the client to take is to address the missed dose promptly by following the proper timing guidelines. So it's more important to focus on helping the client get back on track with their medication schedule. Now, in order for you to correctly answer this question, you need to understand the core of the question, and it is about managing missed doses and maintaining a consistent medication schedule. So you have to also eliminate those drastic adjustments. So Avoid those options that suggest extreme changes in the medication schedule, like skipping doses or, let's say, multiple doses all at once, because these are never recommended in medication management. And so these can also lead to the unnecessary risks, or let's say withdrawal, or maybe overdose. So you have to better focus on safe timing adjustments. Let's have number 38. The nurses caring for a patient with a cirrhosis monitors lab tests. Which test result may indicate that the patient would benefit from neomycin enemas? A, culture and sensitivity. B, white blood cell count. C, alanine aminotransferase level. And D, ammonia level. The answer is letter D, ammonia level. Because one of the critical complications of cirrhosis is the liver's inability to detoxify ammonia, which is a byproduct of protein metabolism. Now, I want you to recall that normally the liver converts ammonia into urea for excretion through urine, but in a case of cirrhosis, this process is impaired. And as a result, the ammonia levels can rise in the bloodstream. It can lead to a condition called hepatic encephalopathy, which can affect both the brain function, and it can cause symptoms such as confusion, lethargy, and even coma. And with the answer, ammonia level. And let's go back into the question itself. This actually talks about the neomycin enemas. This can help manage the problem by reducing the number of ammonia producing bacteria in the gut. And since these bacteria are responsible for generating ammonia during digestion, the elimination or the reduction of their presence can also help reduce the blood ammonia levels, so making neomycin enemas a very suitable intervention when the ammonia levels are high. Now, why is letter A incorrect? The culture and sensitivity. Let's go into the culture and sensitivity, which are actually tests that are typically used to identify specific infections and also to determine antibiotics, and to determine which antibiotics will be used in treating them. But when managing infection, it's also crucial in patients with cirrhosis, especially because of the risk of spontaneous bacterial peritonitis. And so this test does not directly address the issue of ammonia buildup, which is why neomycin enemas would not be indicated based on the result of a culture and sensitivity test. All right. Now, letter B is also incorrect because a white blood cell count is typically used to assess for infection or inflammation. And the elevation of the white blood cell count suggests that the body is fighting an infection, but it does not indicate ammonia buildup, which is the main reason for administering neomycin enemas. And again, going back into the purpose of the drug, it is specifically used to manage elevated ammonia levels. So an elevated white blood cell count alone is not a reason to use it. Now let's talk about letter C, another incorrect option, ALT. We know that this is an enzyme found in the liver that is released into the bloodstream when the liver is damaged. Now, the elevated ALT levels reflect liver injury, but they don't directly indicate elevated ammonia levels or the need for neomycin enemas. And remember again, neomycin's primary role is to address elevated ammonia, not liver injury itself. Again, your technique in answering this question is to identify the core concept, which is basically about managing the ammonia level in a patient with cirrhosis. This is the key concept that should guide you toward the correct answer. And you also need to understand the mechanism of action. Okay, again, the neomycin enemas work by reducing the bacteria in the gut that produce ammonia. All right. Alrighty, so I also want you to not forget to eliminate those irrelevant testing such as culture and sensitivity, white blood cell count, which will help diagnose infection but will not directly relate to the ammonia metabolism or the management of increased ammonia in the bloodstream. Let's have number 39. A nurse administers 0.125 milligrams of digoxin by mouth every morning to a nursing home resident. Under which circumstances should the nurse withhold the medication? Select all that apply. A. Rapid breathing. B. Slow heart rate. C. Abnormal heart rhythms. D. Double vision. E. Vomiting. You have to select all that apply. The correct answers here are letters B, C, D, and E. Let's tackle first letter B, slow heart rate. I want you to remember that digoxin works by slowing down the heart rate through its negative chronotropic effect. Okay? It will slow the conduction through the sinoatrial node and the atrioventricular node, which can reduce the heart rate. And so if the heart rate drops below 60 beats per minute, this could indicate digoxin toxicity or maybe an exaggerated response to the medication. And so in such cases, the nurse should withhold the medication and should notify the healthcare provider, as further lowering the heart rate will become harmful. And in most instances, healthcare providers may set specific heart rate thresholds for withholding the drug, but below 60 beats per minute is a general guideline. Now, what about letter C, abnormal heart rhythms? Take note that digoxin toxicity can cause dysrhythmias, including ventricular arrhythmias and also atrial tachycardia. And since digoxin affects the electrical conduction system of the heart, it can provoke arrhythmias if the levels in the body become too high. And if the patient exhibits abnormal heart rhythms, withholding the medication is also critical until further assessment and serum digoxin levels are measured to ensure they are within the therapeutic range. Now, letter D is another correct answer here because visual disturbances such as double vision, halos around the light, or let's say blind spots are classic signs of digoxin toxicity. Now, if the patient reports these visual symptoms, it is a red flag for toxicity. And so your role here as a nurse should hold the medication and assess serum digoxin levels in order for you to determine whether they are within the therapeutic range of 0.5 to 2 nanograms per ml. And I want you to recall that high levels of digoxin can affect the visual system. So this is a clear indicator that the drug should not be given until further evaluation. Lastly, we have letter E, vomiting. This is also a correct answer because this is one of the symptoms of dig toxicity, particularly when the levels are elevated. So this might result from the irritation caused by the excessive digoxin in the system and can also lead to fluid electrolyte imbalances, which can further exacerbate that toxicity. Now, if the patient is vomiting, you should withhold the medication and monitor the patient for any other signs of toxicity and make sure that a serum digoxin levels is checked to ensure it is within therapeutic limits. Now, letter A, which is actually the incorrect option in this question, rapid breathing or tachypnea is not a known sign of digoxin toxicity. We know that dig can affect the heart rhythm and rate. It doesn't really cause changes in the respiratory rate. And so tachypnea alone is not an indication to withhold the medication. Now, if the patient is exhibiting tachypnea, the nurse should investigate other causes such as respiratory distress or maybe underlying pulmonary issue, but would not necessarily withhold digoxin based on this symptom alone. So I want you to strategize yourself in answering this test question. Go back into focusing on the key effects of the digoxin. It will affect heart rate, it will affect rhythm, and also the electrical conduction of the heart. It can also cause visual disturbances, gastrointestinal symptoms like nausea, vomiting when the drug is in excess, and also to rule out symptoms that are not related to digoxin toxicity. Number 40. A nurse teaches a first-time pregnant client how to identify the onset of labor. Which sign should prompt the client to contact her healthcare provider? A. The membranes rupture or contractions occur every 5 to 8 minutes. B. Contractions occur every 10 to 12 minutes and last about 30 seconds. C. Bloody show and back pressure are noticed. D. Contractions will become regular and increase in intensity. The answer is letter A. That's the membranes rupture or contractions occur every 5 to 8 minutes. All right. Why is this correct? Because the rupture of the membranes is a significant event because it increases the risk of infection for both the mother and baby. Once the water breaks, it's important for the client to contact the healthcare provider immediately, even if contractions have not started or are still irregular, because the risk of infection rises once the protective barrier of the amniotic sac is gone. And to add further to that, the contractions occurring every 5 to 8 minutes suggest the onset of active labor. And these contractions are strong, regular, and getting closer together. And so it is very critical that the client reaches out to their healthcare provider if they experience this combination, so the provider can assess their condition and plan for appropriate care. If you selected either letters B, C, D, letter B specifically, these signs of contractions occurring every 10 to 12 minutes and lasting about 30 seconds are more of indicative of early labor, known as latent phase labor. And the contractions that are spaced 10 to 12 minutes apart and last 30 seconds are generally considered to be part of the early labor phase. And during this stage, the cervix begins to soften and dilate, but the contractions are usually not yet strong or regular enough to indicate labor. And so the client should stay at home and monitor the contractions during the phase, and contacting the provider only if the pattern changes or if the other concerning symptoms arise, such as rupture of the membranes. Letter C is also incorrect. The bloody show, which is a small amount of blood or mucus discharge, and the back pressure can be signs that the body is preparing for labor, but they are not immediate indicators that the client needs to contact the provider. Remember that the bloody show typically occurs as the cervix starts to efface and dilate, and the back pressure can happen as the baby descends into the pelvis. And these can happen in the early labor, and while they suggest that labor may be starting soon, they don't require urgent action unless accompanied by other signs such as membrane rupture or regular contractions. Now let's deal with letter D here, which is another incorrect option. It's because the regular contractions that increase in intensity are a normal progression of labor, and also suggest that the client is entering active labor. Now, I want you to pay attention one more time. Unless the membranes have ruptured, there is no immediate need to contact the healthcare provider just for this pattern of contractions. The client should continue to monitor the contractions and contact the provider if they become stronger and closer together, or if the membranes rupture. So I want you to focus again on the key risk factors And labor, again, one is the rupture of the membranes, which is a key clinical indicator that requires prompt action. It increases the risk of infection for both the mother and the baby, and which is why it's critical for the client to contact the healthcare provider immediately after their water breaks. Now, I want you to also recall the stages of the labor. Okay, so contractions that are 5 to 8 minutes apart and regular usually suggest active labor, but not immediately needing to contact the healthcare provider unless membranes rupture. So you also need to understand the difference between early and active labor, which will help you when the client is in the stage where they need to take actions. Now, you also need to rule out early labor signs like bloody show and back pressure can appear in early labor, which does not always mean the client needs to rush to the provider. These signs alone are not urgent unless the membranes rupture or the contractions become more intense and regular. Now, you also need to watch for the combinations when considering when to contact the provider. Remember that combinations like rupture of membranes with regular contractions suggest it's time to act. And the contractions on their own are normal in the progression of the labor and they're not a cause for immediate concern unless they follow a specific pattern or other complications arise. All right, let's move on into item number 41. A worker sustained a traumatic brain injury after falling from a ladder, resulting in neurological impairments. Which healthcare setting is most suitable for supporting the client and their family in adjusting to these limitations? A, hospital-based acute care unit. B, hospice care program. C, assisted living facility. And D, skilled nursing and rehabilitation center. The answer is letter D. After the client's medical stabilization in an acute care setting, they're going to need a rehab-focused environment to support their recovery and also help them adjust to their neurological limitation. And so a skilled nursing and rehab center is equipped with both intensive rehab therapies like physical therapy, could be occupational therapy, speech therapy, and subacute medical care. And so this setting is specifically tailored to those individuals recovering from maybe neurological impairments, because they're going to focus on improving the functionality and also the independence while also providing the necessary nursing care. And these centers also typically have structured programs that are designed to help patients regain as much independence as possible after an injury like a traumatic brain injury. And the multidisciplinary team provides therapy and support for both the client and their family during the recovery process. Now, the other incorrect options here, we have A, B, C. Let's take a look at the letter A, hospital-based acute care unit. Well, the acute care hospitals are primarily designed to handle life-threatening conditions and provide immediate medical stabilization for serious injuries or illnesses. But once the client's condition is stable, they no longer require the level of intensive medical care provided in acute care unit. And so these hospitals are not equipped to deliver the long-term rehab that the client with a traumatic brain injury would need for recovery. While the client may initially be admitted here, it is not the appropriate setting for continued recovery and rehabilitation. Now, what about letter B, hospice care program? This is also incorrect because hospice care is intended for individuals who are facing terminal illness and have limited life expectancy. And the goal of hospice care is to provide comfort and manage symptoms rather than to rehabilitate or improve functional abilities. And since the client is recovering from a traumatic brain injury and is in need of rehab therapy, hospice care is not the right setting. This is a comfort focused care model, not one focused on recovery. So you got to eliminate this one. Letter C is also incorrect because an assisted living facility is designed for individuals who need some help with activities of daily living, such as bathing, dressing, or meal preparation, but still maintain a relatively high level of independence. So this is a great option for those people who need support, but not intensive medical or rehabilitative care. However, it does not provide the therapy services necessary for someone recovering from a traumatic brain injury. And so the client needs an environment with skilled rehab therapy to address the neurological deficits, which is not something an assisted living facility can provide. So I want you to recall the specific needs of the client. You have to recognize that the client has neurological impairments. Take note of these words. All right. Again, the cause is the traumatic brain injury. And again, the patient will require an environment that offers intensive rehabilitation. Again, you have to focus on settings that provide rehabilitative therapy, subacute medical care, which are the primary needs at the stage of recovery. And I want you to eliminate the acute care units that are focused on life-saving measures, and also eliminate hospice care that focus on end-of-life care, and eliminate assisted living facilities that are more for clients with mild limitations and do not offer the level of rehab that a client with a TBI needs. All right, I hope that's clear enough. Let's have number 42. A nurse is preparing a prenatal class to educate about the physiological changes during pregnancy and the importance of ongoing healthcare monitoring. Which cardiovascular changes should the nurse mention as part of the body's adjustment to pregnancy? Select all that, apply. A, increased cardiac output. B, enlargement of the heart. C, reduced erythrocyte production. D, systemic blood vessel relaxation. And letter E, enhanced blood pressure. Enhanced blood volume. F, increased blood pressure. So let's kind of rephrase this question and understand what it really is asking. So this is actually asking you to select all the options that accurately describe the physiological adaptations to pregnancy related to the cardiovascular system. So the answers here are letters A, B, and E. So let's take a look into letter A first. We know that pregnancy creates an increased metabolic demand, meaning that the body needs more oxygen, nutrients to support both the mother and the growing fetus. And so the heart needs to work harder to deliver these extra resources so it can lead to increased cardiac output. So this is particularly true in the second and third trimesters when the fetus is growing rapidly. The heart pumps more blood per minute to meet the needs of both the mother and the fetus. What about letter B, enlargement of the heart? Well, that's true because as the body increases its cardiac output, the heart will also undergo slight hypertrophy. There's going to be slight enlargement, and this is a normal physiological adaptation to the increased blood volume and the demands placed on the heart during pregnancy. For the reason that the heart needs to pump more blood to meet the metabolic needs of the body, so some degree of enlargement occurs in order to help accommodate the increased workload. Letter E is also correct, enhanced blood volume, in order to support the growing fetus and also to ensure proper perfusion of the fetus, or the uterus rather, and placenta. The body will increase its blood volume during pregnancy. And this increase in the blood volume is very critical for maintaining adequate circulatory support for both the mother and the fetus including the supply of oxygen and nutrients to the fetus, and then removal of the waste products. And so we have options letter C, which is actually one of the incorrect options. Why is letter C incorrect? Well, during the pregnancy, the maternal body can actually increase the production of erythrocytes or the red blood cells to accommodate the increased blood volume. However, this is the big however. Because the plasma volume increases more significantly than the erythrocyte count, this can lead to a condition known as the physiological anemia of pregnancy. And so this means that although the number of red blood cells increases, there is a dilution effect due to the larger plasma volume. And so reduced erythrocyte production is not accurate. Take note of that one. This is false. Now, what about letter D? Systemic blood vessel relaxation. This is also incorrect. We know that pregnancy does involve some vasodilation, especially in the uterine and placental circulations. However, there's going to be systemic blood vessel relaxation. It's not a key compensatory mechanism. So the vasodilation that occurs is more localized, specifically in the uterine and placental blood vessels to support fetal growth and also nutrient exchange. But the systemic vasodilation is not as prominent in pregnancy, so this statement is inaccurate. Now let's have letter F, increased blood pressure. Generally, there's going to be a slight decrease of the blood pressure during pregnancy, especially during the second trimester, due to the effects of vasodilation and other physiological changes. So if a pregnant woman's blood pressure increases significantly, it can be a warning sign of complications such as preeclampsia. So increased blood pressure is not a typical physiological response during pregnancy and should raise concern. Again, we're talking about physiological changes, physiological adaptations. So this is something that you should focus on in answering the question, okay? So in this case, the cardiovascular adjustments during pregnancy are aimed at meeting the increased metabolic demands, knowing that the body needs to support both the mother and the fetus. So focus on the changes that increase heart output, blood volume, and the workload of the heart. So this will help you identify the correct answers that relate to these physiological adaptations. Okay, so you have to eliminate those options that don't fit typical pregnancy physiology. So such as increased blood pressure. It is a red flag. It is not common for blood pressure to rise during pregnancy unless there is a complication like preeclampsia. Another red flag here is the reduced erythrocytes production. Again, this goes against what actually happens in pregnancy because the body increases erythrocyte production to cope with the increased blood volume, even though it can lead to a dilution effect. Another is the systemic blood vessel relaxation is more about localized vasodilation to support pregnancy. So broad systemic relaxation is not a prominent feature. Let's move on to number 43. A patient with acute pancreatitis is being treated to promote rest, maintain nutritional balance, and manage fluid and electrolyte levels. Which nursing interventions are most appropriate? Select all that apply. A, monitor for signs of hypercalcemia. B, monitor cardiac rate and rhythm. C, encourage ambulation in the hall. D, teach relaxation techniques. E, administer pain medication. And F, provide a low-fat diet. The correct answers are letter B, D, and E. Let's take a look into letter B first. Monitor cardiac rate and rhythm. Why is this important? Well, it is because in acute Pancreatitis, there's going to be electrolyte imbalances, and that's a main concern, particularly hypokalemia. Why there's going to be hypokalemia? Well, of course, with the vomiting, because of the intense pain, this can lead to that. And hypokalemia can affect the electrical activity of the heart, leading to potential arrhythmia. So you need to monitor the cardiac rate and the rhythm to detect for any abnormalities that could arise due to the imbalance. Now, what about letter D? Teach relaxation techniques. Well, this can help reduce the stress. It can also lower the metabolic rate. And this is important in pancreatitis because reducing the stress response can decrease pancreatic enzyme secretion. And take note that the goal in the treatment here is to give the pancreas a chance to rest and also to recover by limiting its activity. And relaxation techniques can support this process by managing the patient's anxiety and overall stress level. What about letter E? Administer pain medication. Why is this correct? Well, of course, this is the most crucial aspect, or one of the most crucial aspects in the treatment. We need to administer those analgesics to help control the pain and also to reduce gastrointestinal activity. We know that the pancreas secrete the enzymes to aid in the digestion. And so reducing the pain can help lower enzyme secretion, which can exacerbate the condition if not controlled. And so providing pain medication is a critical intervention to manage the patient's comfort and also to prevent symptoms, worsening of symptoms, I should say. Now, why is letter A incorrect? Monitor for signs of hypercalcemia. Well, the reason why this is incorrect because the correct abnormality, electrolyte abnormality associated with acute pancreatitis is actually low calcium levels. Why? Well, this occurs because calcium can bind to fat in the necrotic tissue as part of the inflammation process. So it's important to monitor for hypocalcemia, not hypercalcemia, and therefore hypercalcemia would not be a concern in this case. What about letter C? Encourage ambulation in the hall. This is also incorrect. This is going to be discouraged. Early ambulation is generally let me restate that. Early ambulation is generally encouraged in many patient population for promoting circulation and preventing complications like DVT. However, in this case with an acute pancreatitis, early ambulation could increase their metabolic rate. It will stimulate pancreatic enzyme secretion, which could worsen the condition. So it's better to limit physical activity initially to help manage the symptoms of pancreatitis. What about letter F? Provide a low-fat diet. Big incorrect. Because during the acute pancreatitis, the patient is typically kept nothing by mouth, meaning they are not given food or not even fluids by mouth to allow the pancreas to rest. And so when you are providing a low-fat diet during the acute pancreatitis stage, this is inappropriate because at this stage, the pancreas needs to be completely rested to prevent stimulating enzyme secretion. But once the patient is stabilized and the condition improves, there's probably going to be dietary changes, including a low-fat diet might be introduced as ordered. But during the initial stages, a low-fat diet would be inappropriate. Take note of that. Resting the pancreas is huge. Now, how are you going to approach this test? Well, I want you to focus on the key management goals for the acute pancreatitis. And this includes, first, resting the pancreas, also prevent complications like electrolyte imbalances, and also to prevent arrhythmias and to manage the pain. So you got to keep these goals in mind when selecting the intervention. So anything that promotes these goals, like cardiac monitoring, pain management, stress reductions, is likely to be correct. And I want you to eliminate those interventions that could worsen the condition, such as ambulation during the early stage. This could worsen the condition by increasing pancreatic enzyme secretion. So remember, rest is important to reduce stimulation of the pancreas. Again, eliminate a low-fat diet. It's not appropriate early in treatment when the pancreas needs to rest. So I want you to recall also about the pathophysiology of the acute pancreatitis, wherein there is hypocalcemia. This is a major concern in pancreatitis due to the fat necrosis binding into calcium. That is why the body is depleted of the serum calcium. You need to monitor the patient for hypocalcemia and hypercalcemia. And to add to the scenario here, there is a critical aspect about watching for possible involvement of maybe involvement of the respiratory muscles, because with the hypocalcemia, this can also lead to laryngospasm, right? Remember, if there is going to be severe form of hypocalcemia, it can also lead to that. So airway is going to be another critical issue when the patient goes into a severe form of acute pancreatitis. And make sure that you really have to recall about the pain relief, which is one of the major interventions in the treatment of acute pancreatitis. It will really reduce the symptoms, and it can also lower the metabolic demands on the pancreas. So this is definitely appropriate intervention. Let's have number 44. A client persistently presses the call bell and requests assistance with tasks they can perform independently. How should the nurse respond? A, point out the behavior to the client. B, acknowledge and understand the client's perspective. C, set firm verbal boundaries. And D, rotate nursing staff to minimize interactions. Let's have the answer, which is letter B. Why is letter B the correct management? Well, the key here is empathy. When a client persistently presses the call light, which means persistent seeking help for tasks that they can handle independently, can maybe come from an underlying anxiety or maybe fear or maybe feelings of helplessness. And in this situation, the nurse's response should focus on understanding the client's emotional state rather than directly confronting the behavior. And you have to acknowledge the client's perspective. The nurse provides reassurance and emotional support, which can help reduce stress and encourage a sense of security. And this is an approach that can also foster a therapeutic nurse-client relationship, which is very critical in this care. Now, what about letter A? Point out the behavior to the client. This is incorrect, because directly confronting the client's behavior could increase their anxiety and lead to a defensive response. So for example, pointing out that the client is asking for help unnecessarily may make them feel embarrassed or misunderstood. And this approach is more likely to escalate the situation rather than solve the underlying issue. And remember that confrontation in this context doesn't address the emotional cost of the behavior, which is essentially for building trust and helping the client manage their anxiety. Letter C is also incorrect. This is setting firm verbal boundaries, because without first addressing the client's emotional needs, this could worsen and it will make the situation even worse. And we know that it is important to establish boundaries. In doing so too strictly or rigidly, this can prematurely increase the client's distress. And instead of doing that, it's important to understand the reason behind the behavior, maybe an anxiety or fear before setting the boundaries. And after that, after you address the underlying costs with empathy, you can now gently set limits in a way that doesn't exacerbate the client's anxiety. Now, what about letter D? Rotating nursing staff to minimize interactions. This is very inappropriate because this might undermine the client's trust and make them feel more isolated, as consistency in caregivers is a key factor in building a therapeutic relationship. And so this response would also reduce the nurse's ability to assess the client's emotional needs. Take note that continuity of care fosters a sense of security and allows the nurse to better understand and also address the client's emotional state. So if there is going to be a changing or maybe a rotation of the caregivers, this will disrupt this relationship. It will make the client feel even more anxious or abandoned. So take note of this. This is very inappropriate. So what is your strategy in answering this question? So you have to first identify that the behavior could be a sign of anxiety or helplessness. So in cases like this, it's essential to focus on therapeutic communication techniques that will address the emotional costs of the behavior rather than just the behavior itself. And take note about the empathy. This is key to build the trust and rapport with the clients. Now, I want you to eliminate those options that could escalate the situation, such as confrontation or confronting the behavior, or let's say immediately setting rigid boundaries or rotating staff. These are going to escalate the client's distress and it will reduce the chance of improving the situation. Let's have number 45. After conducting Leupold's maneuvers, a nurse determines the fetus is in the right occiput posterior or ROP position. Where should the Doppler be placed to best hear the fetal heartbeat? A, above the navel on the left side rather. B, below the navel on the right side. C, below the navel on the left side. And D, above the navel, centered. The answer is letter B. Why letter B is correct? Well, take note that Leupold's maneuvers can help determine the fetal position, and in this case, the fetus is in the right occiput posterior position. And take note that in this position, the fetus's back is located on the right side of the abdomen, just below the umbilicus. And so the fetal heart tones are best heard through the back of the fetus. So when the fetus is in the ROP position, you have to place the Doppler below the navel on the right side to best pick up the heartbeat. Now, what about letter A? It's incorrect, right? Above the navel on the left side. This is inaccurate if the fetus were in, this is only appropriate only if the fetus was situated in a left-sided position, like left occiput anterior or LOA. In that case, the fetal back would be on the left side, and you'd want to place the Doppler on the left side above the navel. But since the fetus is in the right occiput posterior position, this would not be the correct spot. Now, what about letter C? Below the navel on the left side. Another incorrect option, because this position described here is more appropriate for a fetus in a left occiput posterior or LOP, or the left sacrum anterior or the LSA position. So in those positions, the fetal back is on the left side. So you would place the Doppler below the navel on the left side. But for the ROP position, the fetal back is on the right side. So this option is also incorrect. Now, lastly, we have letter D, above the navel, centered. This positioning would be more suitable for a breech presentation, or when a fetus that is positioned more centrally in the uterus. Again, In ROP position, the fetal back is off center to the right. So placing the Doppler above the navel and centered won't be the best choice. It will not be ideal for this specific fetal position. All right. So I want you to recall and understand the fetal position, which will really be the key to answering this question. Okay. Now I want you to use the process of elimination if you're not sure about the specific position of the fetus using. I hope that this can help you with the use of the elimination process. So start by eliminating options that clearly don't fit the fetal position described in the question. For example, any option that mentions the left side of the abdomen can be ruled out immediately since the fetus is in the right posterior position. And also think about the anatomy. Consider that fetal heart tones are generally heard best through the back of the fetus, and you should focus on the area where the fetal back is positioned. And again, in the ROP case, that's below the navel on the right side. And another way of answering this question is to visualize the situation. You have to visualize mentally the placement of the uterus and the fetus inside the mother's abdomen. And so again, in the ROP position, the back is lower and to the right. So it's logical that the best place for the Doppler would be below the navel on the right side. 46. A client begins continuous heparin infusion. How does the nurse determine if the treatment is effective? A. Activated partial thromboplastin time is twice the baseline. B. Activated clotting time, ACT, is between 70 and 120 seconds. C. International Normalized Ratio, or INR, is between 2 and 3. And letter D. Prothrombin time is 1.5 times the control value. The answer is letter A. Why is letter A correct? Well, the heparin therapy's effectiveness is going to be monitored by the APTT. And when a client is on a continuous heparin infusion, the goal is to achieve a therapeutic APTT, which is typically about 1.5 to 2.5 times the baseline or the normal control value. Okay, so this extended clotting time indicates that heparin is sufficiently preventing clot formation, which means that there is anticoagulation going on. So if the APTT is twice the baseline, this means that the treatment is in the desired therapeutic range. It suggests that heparin is working as intended. Now, if the APTT is too low, it suggests that blood isn't being anticoagulated enough, which increases the risk of clots. And if it's too high, it also increases the risk of bleeding. So the APTT is the most reliable measure for assessing the effectiveness of heparin therapy in this case. Now let's get into letter A here. Letter B rather. Activated clotting time, ACT, is between 70 and 120 seconds. Well, let's identify what this is. So ACT is another test that can be used to monitor heparin therapy, but it's typically used in more acute settings or in scenarios wherein there is going to be a need for large heparin doses, especially like during cardiac surgery, rather than a routine monitoring of a continuous heparin infusion. And the expected therapeutic range for ACT is actually 150 to 200 seconds, not 70 to 120 seconds. So this value alone, 70 and 120 seconds, would indicate insufficient anticoagulation. Now, we know that ACT is useful in some cases. It is not the standard monitoring tool for continuous heparin infusion in most clinical situations. So you got to eliminate that one. What about letter C? INR between 2 and 3. This is going to be useful in monitoring what? The warfarin or Coumadin therapy, not heparin. We know that warfarin affects the vitamin K dependent clotting factors, and the INR is calculated based on the prothrombin time. Now, a therapeutic INR is typically around 2 to 3, but this has nothing to do with heparin. Heparin therapy is specifically monitored using the APTT, not INR. So you're going to discard this because this is irrelevant. All right. What about letter D? Prothrombin time is 1.5 times the control value. What is this? This is also incorrect. Like the INR, PT is also used to monitor the warfarin therapy, and the prothrombin time measures the extrinsic and common coagulation pathways, while the APTT monitors the intrinsic common pathways, which is more relevant for heparin therapy. And take note about the value of 1.5 times the control value. It may indicate levels, therapeutic levels for warfarin, but it will not tell you anything about the effectiveness of heparin. Again, I want you to remember about the extrinsic and the common coagulation pathways that will be affected. Again, prothrombin time doesn't assess the anticoagulation when there is heparin therapy. All right. So I want you to pay attention to the key words in the questions like heparin, word effective. This will guide you toward the correct answer, which will involve heparin therapy monitoring, specifically focus on APTT. Let's have number 47. In which of the following situations should a nurse complete an incident report? Select all that apply. A nurse left work early without notifying the supervisor. B, a client missed a prescribed medication dose. C, a nurse slipped in the hallway and fractured an arm. D, a client refused scheduled physical therapy. E, a client climbed over bed rails and fell but was uninjured. F, a visitor assisted a client who was supposed to remain on bed rest. The answers are letters B, C, and E. Let's take a look into letter B first. So, when a medication dose is missed, it's a potential safety risk because it could lead to severe, or it could lead to an adverse effect for the client, especially if it's a critical medication. An incident report should be completed to document the missed dose so it can be reviewed for quality improvement, and also steps can be taken to prevent it from happening again. So it's an unexpected event that might affect the patient's safety, so it needs formal documentation. C is also correct because if a nurse is injured while at work, like this case, it's necessary to file an incident report for occupational safety and liability purposes, and this will help ensure that the workplace is safe and that the incident is documented for insurance and legal reasons. And so take note that any injury sustained in the workplace is an occupational hazard and needs to be reported, even if it's a minor accident. Letter E, another correct option. A client climbed over the bed rails and fell but was uninjured. Okay, here's the deal. Even though the client was not injured, a fall still qualifies as an incident because falls are a serious safety risk, and reporting them helps identify potential environmental hazards or care-related issues that might need to be addressed. And so falls should always be documented in an incident report, regardless of whether or not injury occurs, so that the cause can be analyzed and corrective actions can be taken to prevent further falls. Now, why is letter A incorrect? a nurse left work early without notifying the supervisor. While this is an administrative issue, it does not require an incident report. Take note again that incident reports are meant to document unexpected events that pose a risk to safety or quality of care. If a nurse leaves early without notifying the supervisor, it's an issue of professional responsibility and behavior, but it doesn't affect patient safety directly. This would be addressed by management, not through an incident report. What about letter D? A client refused scheduled physical therapy. Another incorrect option. Why? It's because a client refusing therapy is within their rights. Patients have the right to refuse treatment, including physical therapy, and this should be documented in the client's medical record. And also, it does not require an incident report as there is no risk or harm associated with the refusal itself, as long as the patient's decision is documented properly. Now, what about letter F? A visitor assisted a client who was supposed to remain on bed rest. While this is a situation that should be documented in the client's chart, it doesn't require an incident report. Again, an incident report is generally used for events that are unexpected and present a safety risk. In this case that we have, the issue could be addressed by the healthcare team, but it doesn't rise to the level of needing an official incident report unless it results in a safety concern, such as the client injuring themselves by getting out of bed. Okay, so I want you to really keep that in mind. Now, in order for you to successfully answer this SATA question, you have to understand the purpose of the incident report first. Again, these are documentations that are used to document unexpected events that pose a risk to patient safety or the workplace. And also, you need to look for safety-related events. So focus on incidents that involve safety risks. So this could include medication errors, could be falls, employee injuries, because these are the types of events that should always be documented through this incident report. And you need to also differentiate between the administrative and safety issues, like a nurse leaving early or a patient's right issues, like refusing therapy. These are not usually considered incidents that need to be formally reported unless they result in a safety risks. So, final thoughts here is to eliminate options without safety implications. So if there's any situation that does not directly compromise safety or lead to an unexpected event, like a visitor helping a patient without authorization, should be eliminated. While these situations need to be documented, they do not require the incident report unless they result in harm. Let's have 48. A client presents with severe intoxication from amphetamines and is admitted to the progressive care unit. Which medications would the nurse expect to be prescribed to help alleviate the effects of the stimulant overdose? Select all that apply. A. Benztropine. B. Bupropion. C. Amitriptyline. D. Diazepam. E. Propranolol. The answers are letters D and E. Again, let's go back into the question. This is asking you to identifying which medications the nurse would expect to be prescribed for a client with amphetamine overdose in order to alleviate the effects of the overdose. So one of the answers here is letter D, diazepam. The reason for that's because with amphetamine intoxication, this can cause a surge in dopamine and adrenaline, which increases the risk of seizures due to the overstimulation of the nervous system. Now, let's understand what the diazepam does. The diazepam is a benzodiazepine that works by reducing neuronal excitability, and it has anticonvulsant properties, which makes it effective for controlling the seizure caused by the stimulant intoxication. So, in this case, the diazepam is prescribed to prevent and manage seizures. What about propranolol? E. This is indicated because amphetamines increase adrenaline levels, and this can result in elevated blood pressure and also rapid heart rate. And propranolol, which is identified as Inderal, it is a beta blocker. It works by blocking the effects of adrenaline. It can lower the heart rate. It will reduce the blood pressure. And so this will help control the cardiovascular stimulation or overstimulation, I should say, caused by the amphetamine intoxication. So it is an appropriate medication in this case. Now, what about letter A, benztropine? Why is this incorrect? Well, benztropine is an anticholinergic medication that is primarily used to treat Parkinsonism and also drug-induced extrapyramidal symptoms like tremors and rigidity, but it is not used to treat amphetamine toxicity because it does not target the neurochemical disturbances caused by the amphetamines, such as excessive dopamine or adrenaline. It's not relevant in this case. Now, what about letter B, bupropion? This is widely known as Wellbutrin. It is a medication that increases dopamine and norepinephrine levels, which can exacerbate the effects of amphetamine intoxication, such as agitation, hypertension, and seizures. And so using the bupropion would worsen the patient's situation by increasing the already elevated levels of these neurotransmitters. It's actually contraindicated in stimulant intoxication. So take note of that. Now, letter C, amitriptyline. This is also an incorrect answer. This is a medication belonging to the tricyclic antidepressant classification. This is something that can increase serotonin and norepinephrine levels. So this is a drug that is quite similar to the bupropion. It could intensify the symptoms of stimulant intoxication. And so if you're going to administer this medication, it can boost the levels of norepinephrine. It will worsen the cardiovascular effects. It can worsen the hypertension. It can worsen the tachycardia and can also increase the client's agitation. Eliminate this medication. So, for you to correctly answer this question, I want you to focus on calming and controlling the effects caused by the amphetamines. We know that amphetamines overstimulate both the nervous and the cardiovascular systems. So the medications that can help calm or control these effects are key. So you have to look for those drugs that address seizures. We're talking about anticonvulsants or maybe benzodiazepines, and medications that can help lower the heart rate and the blood pressure. So don't neglect in identifying the key words in this question, like severe intoxication, okay, and amphetamine overdose. This will help you focus on the medications that counteract overstimulation. So think about seizures, tachycardia. These are red flags for what kind of medications would help. All right. And another trick for you to answer this question is to eliminate those meds that increase stimulation. These are bupropion and amitriptyline. These are meds that will increase the dopamine and norepinephrine. Again, it will worsen the symptoms of amphetamine intoxication. Okay. Another is the role of benztropine. Don't forget, it is something that will be helpful for Parkinson's related issues, and also bupropion. This is something that is used for depression and smoking cessation, but neither addresses the acute toxicity of the amphetamines. Okay, so you got to cross them off. Let's have number 49. A nurse expects that newborns of mothers with diabetes may show tremors, cyanosis, poor sucking, and apnea. What condition do these signs indicate? A. Hypercalcemia. B. Cerebral edema. C. Congenital suppression of the islets of Langerhans. D. Hypoglycemia. Let's get into the question first. So this is asking you to identify the condition that is likely to cause tremors, cyanosis, spore sucking, and apnea in newborns of mothers with diabetes. Well, the answer here it is letter D, hypoglycemia. Why? It's because newborns of mothers with diabetes are at risk for neonatal hypoglycemia because they are often exposed to elevated glucose levels in the uterus because of the maternal hyperglycemia. And so this prompts the fetus to produce more insulin, which continues to act even after they are delivered. It can lead to a drop in the blood sugar. And when the blood sugar levels are too low, it can result symptoms like tremors, a bluish color, which is cyanosis, which indicates low oxygen. There's going to be poor sucking. There's going to be pauses in their breathing or apnea. And these are classic signs of hypoglycemia in the newborns. And this condition is going to be seen commonly in the first few hours of life in the babies born to mothers who are diabetic. Now, other options here like A, B, and C are all incorrect. Let's take a look here in hypercalcemia. Why is this incorrect? This is typically not associated with newborns of diabetic mothers. Instead, hypocalcemia is more common in these newborns, and it can present with symptoms such as tremors or seizures. And hypercalcemia would not really explain the other symptoms in the scenario, such as the cyanosis and poor sucking. Why letter B is incorrect? Well, we know that cerebral edema is the swelling of the brain, while it can cause neurological symptoms. It is not typically associated with newborns of diabetic mothers. And the symptoms here, let's take a look. Tremors, cyanosis, apnea actually do not suggest cerebral edema. And to support that, the cerebral edema in neonates usually presents with more severe neurological findings like seizures or, let's say, altered mental status, which are not described in this question. Now, what about letter C? Congenital suppression of the islets of Langerhans. This is also incorrect because this option suggests that the islets of Langerhans in pancreas are suppressed in response to maternal diabetes. However, in reality, the islets of Langerhans in the fetus are often hypertrophied. They are enlarged in response to the high glucose levels in the mother's blood. And this enlargement can lead to increasing insulin production by the fetus, not suppression. So eliminate this one. So this can lead to excess insulin levels in their bloodstream even after birth. And this is the primary cause of hypoglycemia in the newborn. Okay, there's going to be enlargement of their pancreas, not congenital suppression. So for you to correctly answer this question, you need to focus on the classic signs of hypoglycemia. So these are your tremors, cyanosis, poor sucking, and apnea, all common in the newborns who are born to the diabetic mothers. So when you see these signs, you have to link them to the low blood sugar as a potential cause. Let's have number 50. A client who underwent a splenectomy is now back on the surgical unit. What immediate post-op complications should the nurse monitor? Select all that apply. A. Respiratory complications. B. Abdominal distension. C. Blockage of the intestines. D. Infection. E. Shock. The answers here are letters A, B, and E. Why letter A? Because after a splenectomy, one of the immediate post-op complications a nurse should monitor is respiratory issues. This can happen because the diaphragm can be irritated by the surgical site. And this irritation may cause the client to assume shallow breathing, which could lead to atelectasis, which could lead to a partial or complete collapse of the lungs. So it's important to assess the client's breathing and encourage deep breathing exercises to prevent respiratory complications. What about letter B, abdominal distension? It is another key complication to watch for after a splenectomy. We know that the spleen is highly vascular. It means it has a very rich blood supply. So if there is any bleeding or hemorrhage after the surgery, this can cause abdominal distension because the blood can accumulate in the abdominal cavity. And the nurse should be on the lookout for signs of internal bleeding, which could manifest as abdominal girth increase or maybe a firm abdomen. Now, what about letter E, shock? What is this? Well, we know that the spleen has a large blood supply, so shock is another potential immediate complication. So if there is a bleeding from the surgical site, the client may go into hypovolemic shock due to the massive blood loss. And also, this will require monitoring vital signs more frequently, especially the blood pressure and also the heart rate, to detect early signs of shock and make sure that this is done really promptly. Now, what about letter C, blockage of the intestines? Well, a blockage of the intestine is not directly related to splenectomy. We know that intestinal obstruction can occur in some post-op situation, but it's not a typical or immediate complication of this procedure, or splenectomy, I should say. This blockage of the intestines would likely be more related to the abdominal surgeries that directly involve the intestines, such as the bowel resections or any issues like paralytic ileus, but not splenectomy. Now take a look into letter D, another incorrect option. We know that infection is a serious concern after any surgical procedure, but it's not typically an immediate post-op complication after a splenectomy. Infections are more of a delayed complication and could also occur later due to the spleen's role in the immune system. Now, after a splenectomy, clients are at an increased risk of infections, but this usually manifests later on due to the reduced immune function from the absence of the spleen. However, immediate monitoring focuses more on the hemorrhage, the shock, and also the respiratory complications in the first 24 to 40 hours post-op. So I want you to focus on the immediate post-op complications, and you want to look for the complications such as the hemorrhage, respiratory issues, and you have to eliminate the blockage of the intestines, which is not directly associated with a splenectomy. Same thing with the infection. The infection only is going to be more of a delayed complication, not immediate. So it's less likely to be the correct choice for this question. And don't forget, in remembering the anatomy and physiology of the spleen, this is highly vascular. So the major complications that will be involved here will be more on hemorrhage and abdominal distension because it's close to the diaphragm. So respiratory issues can occur from diaphragmatic irritation. Now, I want you to enroll to our NCLEX course and make sure that you check out the website and again, look into the benefits of the offerings. A double lumen nasogastric tube used for decompression has become clogged. What action should the nurse take? A, lower the vent below the stomach level. B, aspirate 30 mL of gastric fluid from the drainage lumen. C, inject 10 mL of air into the vent lumen. And D, reposition the client to a high Fowler's position. The answer here, it is letter C. And why is that? It's because a double lumen nasogastric tube has two parts. the drainage lumen for removing gastric contents, and the vent lumen, which allows air to flow in to maintain suction without causing damage to the stomach. Now, if the vent lumen gets clogged, the installation of air into the vent will clear the obstruction because the air pushes fluid back into the stomach and it will allow proper drainage to resume. And again, this will clear the vent without allowing gastric contents to enter the vent lumen. Also, the vent lumen should always remain above the stomach level to avoid any gastric contents from being drawn into it. Now, what about letter A? This is an incorrect option. Now, lowering the vent below the stomach level is not recommended, and doing this can cause gastric contents to flow into the vent, which can worsen the blockage. And the vent is designed to stay above the stomach to prevent any gastric fluids from entering it, so lowering it would go against the purpose of the vent system. What about letter B? This is aspirating 30 mL of gastric fluid from the drainage lumen. This is incorrect. Well, the step would only verify that the drainage lumen is in the correct position and functioning properly. However, this does nothing for the vent lumen, which is the actual clogged part. The blockage is in the vent lumen, so this action would not address the problem. Now for letter D, repositioning the client to a high Fowler's position is not going to be effective. This can help with digestion and gastric emptying, but it doesn't solve the actual problem of a clogged vent lumen. The clog is in the vent lumen, so again, repositioning of this client will not do any. And I want you to understand the tube's function. This is something that you should remember, especially in a double lumen type of nasogastric tube. It has two distinct functions. One lumen is intended for removing gastric contents. That's the drainage part. And the other is for the vent to prevent suction-related trauma and to keep the stomach at a safe pressure. And the key to clearing the blockage is to address the vent lumen. Now, the best way to clear a blockage in the vent lumen is by injecting air, as it will push any obstruction out and it will resume proper drainage. And you have to look for actions that involve clearing the vent and restoring its function. For you to answer this question correctly, you need to eliminate those options that do not address the vent lumen, such as lowering the vent below the stomach. It would make the problem worse, not better. Another is aspirating gastric fluid is only useful for the drainage lumen, not the vent. And repositioning the client won't clear the vent lumen obstruction. Let's move on to question number 52. A pregnant woman who is 39 weeks along believes her water has broken as she enters the birthing unit. What should the nurse do first? A. Perform Lupul's maneuvers to check for breech position. B. Examine the vaginal opening for the presence of the umbilical cord. C. Conduct a nitrogen test to confirm the rupture of membranes. And D. Listen to the fetal heart rate to assess fetal well-being. The answer is letter B, because when a woman's membranes rupture, there is a risk of umbilical cord prolapse, and this happens when the umbilical cord slips ahead of the baby's head or body, and this can cause cord compression leading to fetal distress or compromise. And remember, this is an emergency situation because it can cause the body's blood supply to be interrupted, and it's life-threatening. The first thing the nurse should do is immediately check for a prolapsed umbilical cord by examining the vaginal opening. Again, this is something that you can do to prevent fetal distress and requires really manual elevation of the presenting part or possibly emergency C-section. Now, the other options, such as letter A, it is incorrect because the Lupul's maneuvers are useful for determining the position of the baby, whether it's head down or breech, but this is not the first step when the membranes rupture. The priority after the water breaks is to rule out cord prolapse, as that can pose an immediate risk to the baby. When you are just checking for the breech position, it can be done after ensuring there are no life-threatening complications like cord prolapse. Now, what about doing a nitrogen test in letter C? This is involving checking of the pH of the vaginal fluid to confirm that it is amniotic fluid, indicating that the membranes have indeed ruptured. But confirming membrane rupture is not first priority when the water breaks. The first concern is checking for cord prolapse, as this is a critical situation that can endanger the fetus. Once that is ruled out, confirming the rupture can be done after. Now, what about letter D? Listen to the fetal heart rate to assess fetal well-being. We know that listening to the fetal heart rate is definitely important and should be part of the assessment. It is not the first thing to do at this case. Now, before checking the fetal heart rate, it's essential for you to check for cord prolapse, because if there is cord prolapse, it will immediately affect the fetal heart rate. You can't really assess the baby's well-being properly if the cord is prolapsed, so as that could alter the heart rate due to the compression of the cord. So for you to answer this question, you got to be critical, making sure that you prioritize life-threatening condition. And the question is about what to do first in a situation where the water has broken. And again, the most immediate risk to the fetus is umbilical cord prolapse, which can cause fetal distress. And so you have to prioritize interventions that address life-threatening risks first. Let's have 53. A first-time mother at 40 weeks presents to the birthing center with abdominal cramps and blood to show, and her membranes ruptured 30 minutes ago. On examination, she is 1 centimeter dilated with the presenting part at -1 station. What is the next best action for the nurse? A, encourage breathing exercises for pattern-paced breathing. B, offer comfort measures appropriate for early labor. And C, prepare for blood typing and cross-matching in case of a transfusion. And D, teach the client how to push with contractions. The answer is letter B. This is an important one to break down. The first-time mother is at 40 weeks and is showing signs of being in early labor. And take note that she's only 1 centimeter dilated and the presenting part is at -1 station, meaning she's just starting to labor. Now, the best action at this point is to provide comfort measures like breathing exercises, changes in position for comfort, and also relaxation techniques, and to help the woman manage the early contractions and promote relaxation. It will make it easier for her to handle the intensity as the labor progresses. Now, at this stage, interventions are all about supporting the mother emotionally and physically through early labor. It's also helpful to keep her calm and focused as things begin to pick up. What about letter A? This is incorrect, because the pattern-paced breathing technique is typically used during the transition phase of labor, which is when contractions become intense and frequent, and the mother may feel the urge to push. Now, early labor, like in this case, involves milder contractions, so this breathing technique is not needed just yet. But for now, breathing exercises should focus on relaxation and managing mild discomfort. Letter C is also incorrect. There is no indication that the mother is experiencing excessive bleeding that would require a transfusion. And this question doesn't mention anything about abnormal bleeding patterns. So preparing for the blood transfusion isn't necessary. And early labor is more about comfort and emotional support rather than invasive medical interventions. Now, letter D, teaching the client how to push with contractions, is also incorrect. Now, take note of the second stage of labor when the mother is ready to push. doesn't begin until the cervix is fully dilated at 10 centimeters. Now, in this case, the mother is only 1 centimeter dilated, and teaching her to push now would be premature and could even be counterproductive. So, pushing before full dilation can cause cervical swelling and may even slow down labor. So, teaching her to push is reserved for later. Now, I need you to focus on the stage of labor in this type of question. The key clue in the question is that the client is 1 centimeter dilated with the presenting part at -1 station, indicating that she is in early labor. Again, in early labor, the priority is to provide comfort and emotional support, not to focus on advanced stages of labor. So your intervention should focus on supportive care, and you've got to eliminate those options for later stages of labor. Let's have number 54. After a partial gastrectomy, a nurse educates a patient to prevent long-term complications. Which aspects should be included in the educational plan? Select all that apply. A, eat 3 small meals daily. B, limit fluid intake to 1,500 mL per day. C, eat a high protein diet. D, receive vitamin B12 injections regularly. And E, consume foods rich in calcium. The correct answers are letters C, D, and E. Let's start first with letter C, eat a high protein diet. Now, after a partial gastrectomy, the stomach's ability to hold and process food is reduced. And so protein-rich foods can help in so many ways. This can slow gastric emptying, which reduces the risk of dumping syndrome, which is that condition where food moves too quickly into the small intestine. It can cause symptoms like nausea, diarrhea, and dizziness. And by eating more protein, patients can better manage this risk. Now, what about letter D? Receive vitamin B12 injections regularly. Well, remember that the stomach plays a key role in the absorption of vitamin B12, especially because of a substance called intrinsic factor. After a partial gastrectomy, intrinsic factor secretion may be impaired, leading to B12 deficiency over time. Now, without sufficient intrinsic factor, the body can't absorb B12 from food. B12 injections are often needed lifelong to prevent this deficiency, which can lead to nerve damage and anemia. The last correct option here is letter E, consume foods rich in calcium. Now, after a partial gastrectomy, calcium absorption can be affected because of changes in the digestive system. And recall that calcium is important for bone health, and if the body can't absorb it properly, the patient may be at risk for osteoporosis or weakened bones. And so calcium supplementation or eating calcium-rich foods is critical to help maintain bone density. Now, the wrong options here includes letter A, which is eat 3 small meals daily. Why is this incorrect? Well, remember that after a gastrectomy, it's actually more beneficial to eat 6 smaller meals a day instead of just 3, because this will help in better digestion and prevents the stomach from becoming too full, which can lead to discomfort or nausea. And by eating more frequently in smaller portions, the body can better process the nutrients and avoid complications like dumping syndrome. Another incorrect option here is letter B, limit fluid intake to 1,500 mL per day. Well, take note that after gastrectomy, fluid intake should not be restricted. And in fact, it is essential to stay hydrated because limiting fluid intake could lead to dehydration and electrolyte imbalances, which can also complicate their recovery. Now, a more common recommendation is to drink fluids in between meals, not during meals, to avoid bloating and also to help manage the risk of dumping syndrome. and the fluid intake should be increased as needed. So 1,500 mLs would generally be too low for a patient post gastrectomy. Now, when you are answering this question, you have to focus on long-term dietary changes post-surgery. And since the question asks about long-term complications, think about nutritional changes necessary to prevent those complications or complications rather. And so the key here is the patient's ability to properly absorb nutrients like protein, vitamin B12, and calcium. And keep in mind that B12 and calcium need to be supplemented because the stomach no longer functions at full capacity. You also need to look for answers that directly relate to post-gastrectomy complications, like keywords like protein, B12, calcium. These are important because they directly relate to the long-term nutritional needs after surgery. Now, I want you to remember that protein helps with digestive health. B12 supports nerve function and red blood cell production, and calcium ensures bone health. Now, when you answer this question, I want you to eliminate those answers or options that limit essential nutrients. So if you selected letter A or B, both are incorrect because they involve a restricting intake, either the number of meals or fluid intake, which could worsen the patient's condition by reducing essential nutrients or hydration. So you got to look out for those answers that seem restrictive, as they're often aren't in line with the current guidelines for post-surgical care, such as this one. 55. When administering a vaginal suppository, which nursing actions are appropriate? Select all that apply. A, position the client in the dorsal recumbent position. B, insert the suppository along the posterior vaginal wall. C, use clean gloves during insertion. D, lubricate both the suppository and the gloved index finger. E, instruct the client to remain flat. 4, lying flat for 20 minutes post-insertion. And F, perform vaginal irrigation before administration. The answers are letters A, B, C, D, and E. Let's start with letter A. Take note that the dorsal recumbent position, of course, this is lying on the back with the knees bent and feet flat on the bed. This is the most comfortable and effective position for administering a vaginal suppository. It also provides good access to the vaginal canal. It allows the nurse to insert the suppository easily and can also ensure the medication is placed in the correct location for absorption. Letter B is also correct because inserting the suppository along the posterior vaginal wall is also key for proper placement. This is most likely to dissolve correctly and be absorbed near the cervix. And this can also ensure that the medication reaches the target area and it can maximize its effectiveness. Letter C is also correct since the vagina is not considered a sterile cavity. Clean gloves are sufficient for this procedure. And this is in line with the medical asepsis, not surgical asepsis. So the goal here is to avoid introducing harmful pathogens, but sterile technique is not necessary for a simple vaginal suppository insertion. Letter D is also correct because lubricating both the suppository and the gloved index finger can ensure smooth and easy insertion while minimizing the risk of mucosal irritation. And the lubricating gel also makes the process more comfortable for the patient. Lastly, we have letter E. After the insertion, it's essential for the patient to remain lying flat for a period, usually around 20 minutes, to prevent the suppository from slipping out. And this is going to ensure that the medication stays in place long enough to be absorbed and can take full effect. Now, the incorrect answer here is letter F. Performing vaginal irrigation before administration is unnecessary unless specifically ordered by a physician. Now, what's supposed to be done is the perineal care, which involves cleaning the external genital area. It's usually sufficient before inserting the suppository. And if the vaginal irrigation is done, it may interfere with the effectiveness of the suppository and is not a standard step in the procedure. So I want you to understand what the procedure is about when you are answering this question. And you need to recall the standard steps for this procedure. Focus on positioning, the placement, and the use of lubrication to ensure comfort and effectiveness. And you got to identify the necessary versus unnecessary interventions, such as the use of the irrigations, which may sound reasonable, but it is not required, and it might cause the suppository to become ineffective. So eliminate that. Let's have number 56. When a nurse obtains a health history for a 4-year-old child diagnosed with ADHD, which behaviors should be anticipated? Select all that apply. A, intentionally irritates others. B, engages in excessive video game play. C, has difficulty completing tasks. D, acts impulsively. Letter E, speaks excessively. And letter F, displays vengeful and malicious behavior. Now, the answer here, there are multiple answers. We have letters B, C, D, and E. Well, let's take a look into letter B first. Why is this correct? Well, children with ADHD often have difficulty staying focused or engaged in low stimulation activities. So they need to seek out things that hold their attention better, such as video games. And these games provide constant action and feedback, which can help ADHD kids stay focused. However, this could become problematic if the time spent on video games is not managed well. Letter C is also one of the correct answer. It's one of the hallmarks of ADHD, which is inattention and distractibility, meaning the child might start tasks but have trouble finishing them. And they can get easily sidetracked, which makes it difficult to follow through on tasks, whether it's homework, chores, or even just playing with the toys. Letter D is also correct. Impulsivity is another key characteristic of ADHD. Children with this disorder often act without thinking about the consequences, and this can show up as interrupting conversations, jumping into activities without planning, or even taking physical risks because they can't wait to act. And impulsivity makes it hard for them to stop and think before doing something. Letter E is also one of the correct answers. Hyperactivity in ADHD can often show up as being overly talkative, and these children may speak loudly or excessively, often without considering if it's the right time to talk. They might interrupt others or continue talking even if the other person isn't responding. It's just part of the way the hyperactivity and lack of impulse control manifest. Now, letter A is one of the incorrect options here. Intentionally irritates others. Why is this incorrect? Well, intentionally irritating others is more aligned with a different condition like oppositional defiant disorder, or what we call as ODD. And while the children with ADHD might sometimes be frustrating or seem annoying, their behaviors aren't typically driven by a desire to be intentionally irritating. Instead, they might act impulsively or without thinking, but it's not usually about trying to annoy others on purpose. F is another incorrect answer, because vengeful or malicious behavior is more characteristic of ODD, not ADHD. Because children with ADHD may act impulsively, but they typically don't plan to get back at others or seek revenge. Their actions are often more spontaneous and driven by their inability to control impulses rather than by a desire to hurt others intentionally. Now, when you answer this type of question, focus on ADHD core symptoms. When you're reading through the options, keep in mind the core symptoms of ADHD, which are inattention, impulsivity, and hyperactivity. And keywords like difficulty completing tasks, impulsivity, and excessive talking should make you think of ADHD. And you also need to look for the right context. You got to pay attention to words like vengeful and intentionally irritating, which are not related to ADHD, because these describe behaviors more commonly seen in oppositional defiant disorder. And if you see these words, they're likely the wrong answers for ADHD. You also need to be careful with how you interpret behavior, because kids with ADHD may engage behaviors that seem disruptive or frustrating, but it is really important to distinguish them between behaviors caused by impulsivity and those driven by a deliberate intent to annoy or hurt others, because ADHD kids are often acting on impulse rather than with malicious intent. Let's have number 57. A client is about to undergo a pulmonary function test. The therapist instructs the client to breathe normally. What is being measured during this phase of the test? A, vital capacity, B, expiratory reserve, C, inspiratory reserve, and D, tidal volume. The answer is letter D. The tidal volume is the volume of air that is exchanged with each normal breath. And this is the air you inhale and exhale effortlessly without making any extra effort. You don't need to take a very deep breath. And so when the therapist says breathe normally, it's asking the client to breathe just like they should in their everyday life, not doing anything like being forceful or excessive. So the tidal volume is being measured here because it reflects regular, spontaneous breathing. So write that down. That should be your key to remembering the tidal volume. Now, letter A, vital capacity refers to the total volume of air the lungs can hold. And this includes tidal volume. It also includes inspiratory reserve volume, expiratory reserve volume, and the residual volume, which is basically the air that is left in the lungs after exhalation. So the vital capacity is a broader measurement that requires more effort than just normal breathing. And since the instruction in that case was to breathe normally, the test isn't looking at all that air capacity, just the normal exchange during the relaxed breathing. Now, letter B is also incorrect because expiratory reserve volume refers to the maximum air you can forcefully exhale after a normal exhalation. So this involves active effort, which is not what's happening when you're instructed to breathe normally. And if the therapist had asked the client to exhale forcefully, then this would be relevant. But in this case, the focus is just on the normal breathing, so it's not the right choice. Letter C, which is the inspiratory reserve volume, is the extra air you can inhale after a normal breath. So like expiratory reserve volume, this requires effort, taking a deep breath to maximize inhalation. But then again, the instruction here is to breathe normally, not to inhale as deeply as possible. So inspiratory reserve volume isn't measured during this phase. So for you to answer this question, I want you to focus on the key phrase, breathe normally. This is the most important clue. The test is measuring the amount of air exchanged during normal, relaxed breathing. That's what tidal volume is all about. Number 58. A home care nurse is assisting a client who was recently discharged following hospitalization for CVA. The client presents with left-sided weakness, impaired swallowing, and increased anxiety. Which intervention best exemplifies the nurse's role as a resource provider? A, teaching the client relaxation techniques for managing anxiety. B, demonstrating proper use of a walker for mobility support. C, assisting the client in accessing appropriate community healthcare services. And D, advising the client to chew food slowly and thoroughly. The correct answer is letter C. And why is that? Because as a resource provider, the nurse plays a key role in helping the client navigate the healthcare system. Take note that stroke recovery can be challenging and clients may need assistance understanding available services and connecting to healthcare providers that can support their recovery. And so this is going to include helping with things like finding home healthcare services, maybe rehabilitation programs, or even mental health resources to deal with anxiety. And so the nurse's role here is about connecting the client with resources that go beyond direct care, like teaching techniques or providing therapy. It's about ensuring the client has the services they need to continue their recovery at home. And so if you selected letter A, this is incorrect. We know that while teaching relaxation techniques can be very helpful for anxiety, but this falls under the nurse's role as an educator rather than a resource provider. It's more about directly addressing the client's emotional state and teaching them tools for self-management, which is important, but it doesn't involve connecting the client to external resources. B is also incorrect. We know that this is a great intervention, but it is also an example of the nurse acting as an educator rather than as a resource provider. So in letter B, the nurse is teaching the client how to use the walker for safety and mobility, but this doesn't involve helping the client connect to additional services or navigate community healthcare system. Letter D is also incorrect. This recommendation is related to ensuring safe swallowing and preventing aspiration, which is also part of health education. We know that this is definitely important for the client's recovery, but this is another example of a nurse teaching rather than helping the client access resources outside the direct care setting. So for you to answer this question correctly, you have to focus on the key role of a resource provider. This simply means the nurse is helping the client connect with external services or navigate healthcare system rather than providing direct education or teaching. 59. A nurse assesses a postpartum client 3 hours after delivery. The uterus is soft and above the umbilicus, and the bladder is displaced. The perineal pad is saturated with blood. What should the nurse do next? A. Notify the healthcare provider. B. Help the client to the bathroom. C. Increase the IV infusion rate as prescribed. And D. Massage the uterus again. The answer is letter B. And why is that? Well, the key to this situation is the displaced bladder. Let me turn on my pointer here. Bladder is displaced. Take note that after a delivery, a full bladder can displace the uterus. It can cause it to become buggy. It will make it soft, which can lead to increased bleeding. And the first thing you want to do is help the client empty her bladder. And this is a non-invasive step that can often resolve the issue. And so by emptying the bladder, the uterus can return to its normal position and uterine tone can improve. It can reduce the bleeding. So if the client is unable to urinate on her own, then catheterization might be necessary. But the first step is to assist with bathroom use to encourage the bladder to empty naturally. Take note of that. Now, one of the incorrect answers here is letter A, notify the healthcare provider. We know that notifying them should be, it is also important if the bleeding does not stop after emptying the bladder and after massaging the uterus. Notification right away around this test question is premature. And what you should do here instead is address the bladder, okay? It's important to remember that the nurse should first try to solve the issue before escalating to a provider unless it's an emergency. Now, letter C, here, another incorrect option. increase the IV infusion rate as prescribed. Increasing the IV rate might be necessary later on if the bleeding continues or the client's condition worsens. However, it's not the first step here. The priority is to empty the bladder and help improve uterine tone before deciding whether more aggressive interventions like IV fluid adjustments are needed. Letter D, another incorrect option, massage the uterus again. Well, uterine massage is an important intervention for uterine atony. This is a condition where the uterus doesn't contract well. But if the bladder is distended, it won't be as effective. The full bladder in the scenario displaces the uterus, and even if you massage it, the uterus may not contract properly due to the physical obstruction. And emptying the bladder is the first step to help with uterine tone. So for you to answer this question correctly, you need to look for the physical clues in the question stem, such as displaced bladder. That is a big clue. A full bladder is often overlooked, cause of uterine atony, which can result in excessive bleeding, and this should immediately guide you to think about emptying the bladder as the first step. And you also need to focus on non-invasive actions first. And the first thing you should try is a simple non-invasive intervention by helping the client to the bathroom so that they can try at least to empty their bladder. And again, if it doesn't resolve the issue, you can move on to other actions like massaging the uterus or increasing IV fluids, or maybe getting an order for straight catheterization to empty the bladder. Okay? Do not jump to escalation like notifying the provider or increasing the IV rate too early. These are going to be necessary at a later time. Okay? But you have to do your initial step. 60. A teenager at 32 weeks gestation is admitted with preeclampsia. She expresses feelings of depression and loss of appetite. Which statement indicates the need for further exploration of the client's emotional state? A, I can't wait to finally get home, get some uninterrupted sleep. B, I had a dream that my baby was born with only one arm. C, I was really happy before I got pregnant. D, I feel so awkward and clumsy these days. The answer to this question is letter C. Why is letter C the answer? Well, this statement alone reveals an emotional disconnect from the pregnancy. The client is expressing feelings of nostalgia or longing for the time before pregnancy, indicating that she may not have fully accepted or adjusted to the changes and the challenges that come with it. And so take note that teenagers in particular may struggle with feelings of loss or identity during the pregnancy, and this comment suggests that she may not be coping well with her current situation. Because the inability to embrace the pregnancy, especially at this stage, 32 weeks, could signal unresolved emotional conflicts that need to be further explored. Now, take note that emotional adjustment to pregnancy, particularly in the first trimester, is a key milestone. The statement alone hints that the client might not have fully processed the emotional transition. This will require additional emotional support or counseling. Now, letter A is one of the incorrect options. This is a statement of a typical concern for someone in the third trimester because the baby grows, the uterus expands, and sleep becomes more uncomfortable. Often can lead to frequent waking, and difficulty sleeping. It's a physical discomfort and not a red flag for emotional distress. And around this stage in pregnancy, especially for someone with preeclampsia, it's normal to have concerns about sleep due to physical discomfort. Letter B, another incorrect option here. So this statement actually reflects about fears about the baby's health and potential birth defects. These are not uncommon during pregnancy, especially in the third trimester when women may start to focus more on the well-being of their unborn child. And this is an example of a concern that reflects normal anxieties and worries about the baby's development. While the dream may sound unsettling, it doesn't necessarily indicate an underlying emotional issue that needs further explanation, especially since worries about the baby's health are typical at this stage. Now, letter D, another incorrect option. This statement of feeling awkward and also clumsy is a very normal part of the third trimester. And as the pregnancy progresses, a woman's body undergoes many physical changes like an expanding, growing belly, shifting center of gravity, and joint looseness due to the hormonal changes. These changes can easily make a woman feel less coordinated. And so it's important for you to remember that physical changes like these often lead to feelings of discomfort, but they're not typically signs of emotional distress. Now, for you to answer this question, you have to look for emotional disconnect or feelings of distress. And in this case, the phrase "before I got pregnant" is a red flag. It indicates that the client is focusing on a time when she felt really happy, which contrasts with her current situation. And this disconnect suggests emotional dissatisfaction or even regret, and this warrants further exploration. Okay, let's have number 61. During the first 36 hours following the placement of chest tubes, a nurse observes that the water in the water seal tube isn't fluctuating. What should the nurse do first? A. Inspect the tube to verify there are no kinks. B. Position the patient on the side that is not affected. C. Notify the healthcare provider. And D. Record the patient's vital signs. Your answer should be letter A. Why? The water seal system in a chest tube drainage setup acts as a one-way valve, and its primary role is to show if air or fluid is leaving the pleural cavity and if the lung is re-expanding as expected. Now, the water in the seal should fluctuate with breathing, so this is what we call as tidling. It also indicates that everything is working correctly. Now, if there is no fluctuation, the first thing to check is whether the tube is blocked or kinked. Now, take note that a kink or an obstruction could prevent the necessary air or fluid drainage, can lead to a situation where the water seal no longer fluctuates. So before jumping to other interventions, the nurse must inspect the tube for any visible blockages or kinks. What about letter B? This is an incorrect option, right? Because we know that patient positioning can play a role in drainage. It is not the first priority, though, when you see that the water seal isn't fluctuating. So moving the patient to a side that isn't affected may help in some cases, but it's not going to solve the underlying issue if there is a physical blockage or obstruction in the tube. Another thing is that positioning the patient in a way that doesn't support the chest tube could lead to complications like dislodging the tube or potentially preventing the lung from expanding fully. So addressing the tube issue should come before thinking about positioning. Now, letter C, notify the healthcare provider is incorrect in this case. We know that notifying the healthcare provider might be necessary eventually, but this should not be the first thing you do. What you should do first is to do the troubleshooting the problem by inspecting the tube for kinks or obstructions. The notification to the healthcare provider can come later or after the nurse has investigated the cause of the issue, especially when the problem would be something as simple as a kink in the tube that can be easily fixed. Now, letter D. Record the patient's vital signs. Yeah, it's important to monitor the vital signs. That's a good intervention, especially after a procedure like chest tube placement. But vital signs are not the first thing to focus on when you see that the water seal isn't fluctuating. Again, the priority here is to troubleshoot the mechanical issue with the chest tube. If the chest tube is blocked or kinked, it could compromise the patient's respiratory function. You need to fix that one. All right. So when you answer this question, you need to look for keywords. The water seal is a key term that ties the question to the chest tube drainage system. And so you also need to understand the role of the water seal, specifically that it should fluctuate when air or fluid is leaving the pleural cavity. It will help you to pick up the right answer. Okay. And you also need to focus on troubleshooting first. So if you notice that the water isn't fluctuating, the nurse's immediate action should be to inspect the chest tube for any blockage or kinks. Okay. You don't see any other issues other than the observable, there's no observable fluctuation. Okay. However, if there's going to be other complications or if there's going to be difficulty in the breathing of the patient, then our interventions probably would be totally different in this question. Let's have number 62. A client with osteoporosis is seeking dietary advice. Which of the following foods should the nurse recommend to promote bone health? Select all that apply. A, sardines. B, almonds. C, tomatoes. D, rice. E, milk. F, yogurt. The correct answers are the following. We have A, B, E, F. Well, why sardines? Well, take note that sardines are a fantastic source of calcium. The key here is that sardines have edible bones, which contribute a substantial amount of calcium. So expect that a 3-ounce serving provides at least good 371 milligrams of calcium, which is great for bone health, especially for a client with osteoporosis. B, almonds is also correct because they are another plant-based source of calcium. They aren't as high in calcium compared to the other foods, but they still contribute to meeting calcium needs. And the almonds also provide a decent amount of calcium, making them a good choice for bone health. Now, letter E, milk. It is a well-known source of calcium and is a standard recommendation for promoting bone health. And take note that a cup of milk, low-fat milk specifically, which is 1%, contains around 290 milligrams of calcium. And for a client with osteoporosis, this is a great option to help maintain bone density. We also have letter F, which is the yogurt. It's another food item that is a rich source of calcium. It can provide about 400 to 450 milligrams per 8-ounce serving. And it's often considered one of the best calcium sources available, making it ideal for supporting bone health and osteoporosis. Now, the incorrect options here include letter C, tomatoes. We know that they are nutritious, but they are not a significant source of calcium. And take note that a medium tomato contains only about 9 milligrams of calcium, which is minimal. And it's not going to be enough to support bone health in someone with osteoporosis. Now, recall that the primary benefit of tomatoes is their vitamin C content, not calcium. We have letter D, rice. This is also incorrect. It's similar to tomatoes. It's not a good source of calcium. It only contains a negligible amount of calcium, around 5 to about 33 milligrams per cup. And it depends also on the type of the rice. And it can be a healthy source of carbohydrate, but it will not help with bone health because of its low calcium content. So you need to review on and also focus on the rich calcium sources. So we are inviting you to enroll to our NCLEX course. You have to visit the website, stancoastnclexcoaching.com. Let's continue. 63. What intervention should be included in a newborn's care plan to prevent the development of hyperbilirubinemia in a breastfed baby? A, substituting formula feeding for breastfeeding on day 2. B, offering glucose water as a supplement on the first day. C, encouraging more frequent breastfeeding during the initial 48 hours. And D, administering phototherapy for 30 minutes every 6 hours for 3 days. The answer is letter C. Why is this correct? Well, because frequent breastfeeding helps the newborn pass meconium, the baby's first stool. And take note that meconium contains bilirubin, and by passing it out of the body, the baby is preventing the reabsorption of bilirubin into the bloodstream. So, more frequent breastfeeding not only helps with hydration and nutrition, but it also promotes bilirubin excretion, which reduces the risk of developing hyperbilirubinemia. This is the preventive measure we're looking for. Now, letter A is incorrect. Substituting formula feeding for breastfeeding on day 2. This is incorrect. The formula feeding is not necessary for preventing hyperbilirubinemia in a breastfeed baby. In fact, early breastfeeding is preferable because it helps to stimulate the gastrointestinal activity and also supports the baby's ability to eliminate bilirubin naturally. And so, substituting formula for breast milk, especially early on, could also disrupt the process of promoting breast milk production and bilirubin elimination. And another thing is that formula feeding may be necessary in some cases, but it's not a preventative measure for jaundice. Letter B, another incorrect option, because offering glucose water as a supplement is not a recommended strategy for preventing hyperbilirubinemia. The best option for eliminating bilirubin is breast milk or formula. Both can provide the necessary calories and fluids to encourage proper GI function and bilirubin excretion. Now we have letter, glucose. Water, on the other hand, it doesn't really contribute to bilirubin elimination and could also interfere with a newborn's feeding patterns by filling the baby up with a solution that doesn't really provide much nutritional value. Letter D, administering phototherapy for 30 minutes every 6 hours for 3 days is incorrect. We know that phototherapy is a treatment for hyperbilirubinemia after jaundice has already developed. It is not used as a preventative measure. Take note of that. Remember that in phototherapy, light helps break down the bilirubin in the baby's skin, but this intervention is meant for treating jaundice, not preventing. Now, take note that preventative measures like frequent breastfeeding should be taken before jaundice develops to keep bilirubin levels in check. So, your strategy here in answering this question is to focus on the word prevent. The question asks for an intervention to prevent hyperbilirubinemia. This simply means that we are looking for a preventive strategy, not a treatment. So you're supposed to eliminate options that focus on treatment, like phototherapy, or other treatment measures like formula feeding or glucose water. Those are not preventive steps and should be eliminated. 64. A patient with a gunshot wound to the chest has chest tubes inserted in both the second intercostal space and the base of the lung. What is the purpose of the chest tube in the second intercostal space? A, drain fluid from the pleural cavity. B, allow for positive pressure development between pleural layers. C, provide access for medication into the pleural space. And D, remove air from the pleural cavity. The answer is letter D. And why is that? The chest tube placed in the second intercostal space, which is the upper part of the chest, is specifically used to remove air from the pleural cavity. This location is ideal because air in the pleural space rises And positioning the chest tube high up allows the air to be evacuated effectively. And this is commonly used in cases like pneumothorax, where the air accumulates in the pleural space, causing the lung collapse. So the upper placement of the tube can help relieve the pressure by draining the air and also allowing the lung to re-expand. Now, letter A is one of the incorrect options here. The fluid drainage, such as the blood or serous sanguineous fluid, is typically handled by a chest tube placed lower in the pleural space, usually near the base of the lung. And the reason for that is because by gravity, naturally, fluids will collect in the lower part of the pleural cavity. And so the chest tube positioned at the base is more effective for fluid drainage. Now, take note that the chest tube in the second intercostal space is not for fluid drainage, but rather for air evacuation. Letter B is also an incorrect option. Positive pressure between the pleural layers would create a pneumothorax, which is the opposite of what we want. And so pneumothorax happens when air gets trapped in the pleural space, which can lead to a collapsed lung and also difficulty breathing. And take note that the goal of the chest tube is to remove air from the pleural space, not allow for positive pressure. Positive pressure alone would worsen the situation, not going to help it. Letter C, another incorrect option. The reason it's because chest tubes are not used to administer medication directly into the pleural space. Their primary function is to remove air or fluid that could compromise lung function. And take note that medication administration in the pleural space would generally be done via other procedures such as could be thoracentesis, not through the routine use of a chest tube. So this is not the purpose of a chest tube inserted into the second intercostal space. So for you to answer this question correctly, you need to pay attention to the location of the chest tube. That's the key about its purpose. Now let's have 65. When preparing a client with severe depression for electroconvulsive therapy, what key points should the nurse include during the discussion? A, there could be permanent short-term and long-term memory loss. B, you may ask any questions, but it's better to avoid discussing the procedure. C, the procedure is entirely risk-free with current techniques. And D, you will be asleep during the treatment and won't experience any pain. The answer is letter D, and the reason for that, it's because one of the biggest fears a client may have about ECT is the concern about pain or discomfort during the procedure. This is why reassuring the client that they will be asleep due to general anesthesia and won't feel any pain is very crucial. It's going to help reduce the anxiety and also prepare the patient mentally and also emotionally. And the reassurance is both comforting, it's accurate, it's not false reassurance, because the client is unconscious during the procedure and is not aware of the electrical stimulation. Letter A is incorrect because memory loss after the electroconvulsive therapy is typically short-term and temporary. It's not permanent. And most of the clients will experience some temporary memory gaps, like forgetting events around the time of treatment, but these usually improve over time. Now, stating that memory loss could be permanent may create unnecessary fear and misconceptions. It's very important that you're going to provide accurate information to avoid adding to the client's anxiety. B is also incorrect. It's very essential for clients to feel they can ask questions and discuss the procedure openly, and avoiding the discussion of the procedure could leave the client feeling more anxious and unsure. And so providing clear and thorough explanations can help reduce the client's fear and allow them to feel more empowered and informed. And so encouraging questions can also help create a supportive environment and also will enhance the trust. Letter C is another incorrect option here. We know that ECT is generally safe. It's not entirely risk-free. There are known risks such as temporary memory loss and potential cardiovascular complications. And so claiming the procedure is risk-free would provide a misleading impression and fail to inform the client about possible side effects. And so you need to provide a balanced view of the risk and the benefits, and this will help ensure informed consent and realistic expectations. So when you're answering this question, you have to focus on the emotional support and reassurance the client needs when preparing for a procedure like ECT. They are very nervous about the pain, the side effects, and the unknown. So you need to be more comforting and reassuring in your answers. And in this case, you have to assure the client that they will be asleep and won't experience any pain. So, number 66. A neonate born at 36 weeks gestation weighs 4 pounds, 3 ounces, and has APGAR scores of 7 and 9, respectively. What actions should be prioritized on admission to the nursery? Select all that apply. A. Offering a bottle of dextrose and water. B. Evaluating the neonate's health status. C. Providing warmth to maintain body temperature. D. Recording vital signs. And E. Administering oxygen. This is a select all that apply. Your answers are the following: B, C, and D. Okay, why letter B? The health status evaluation is always the first priority for any neonate upon admission, regardless of gestational age or weight. It's essential to perform a thorough assessment to determine whether the neonate is stable and also identify any immediate concerns that need to be addressed. And take note that this is a routine but critical step, first step, I should say, in newborn care. Letter C is also correct because you need to maintain warmth. This is a top priority for neonates, especially for those born preterm or for those who are low in their birth weight, like the baby is at 36 weeks and weighing only 4 pounds and 3 ounces. Remember that neonates have limited ability to regulate their body temperature, and they are at a higher risk of hypothermia, which can lead to serious complications like hypoglycemia, respiratory distress. And so this is a very straightforward yet very vital action. Another option here is letter D, which is also correct because vital signs are part of the routine assessment for every neonate. You need to include checking the heart rate, monitoring the respiratory rate, temperature, the oxygen saturation. You can assess the neonate's overall health and make sure that everything is functioning as it should be. And so take note that the vital signs alone can give you a snapshot to how the baby is doing and whether there are any underlying issues. And so letter A is one of the incorrect options. Offering a dextrose in water is not a standard practice for newborn care. Typically, newborns will either be breastfed or formula fed because glucose water is generally not recommended unless there is a specific indication like hypoglycemia. But in this case, the neonate's condition as indicated by the APGAR score of 7 and 9, and there are no immediate signs of hypoglycemia, doesn't really warrant this intervention. Letter E, another incorrect option. Remember that oxygen administration isn't needed unless the baby is showing signs of respiratory distress. And take note that the APGAR score of 7 and 9 is a good score. It indicates that the body is breathing well and does not require immediate intervention like oxygen. But if the baby was struggling to breathe or had a lower Apgar score, then oxygen would be necessary. But here, the baby is stable enough to not need supplemental oxygen. So when you're answering this test question, you need to pay attention to the Apgar score, 7 and 9, and also the gestational age. Okay, take note that the Apgar score of 7 and 9 indicates that the baby is relatively stable with no immediate distress. So this is going to help you rule out unnecessary interventions like oxygen administration or glucose water. And you need to prioritize actions that are essential and universally applied to all newborns. So these are, again, your letters B, C, and D. Let's have number 67. A client is prescribed a 2-gram sodium restricted diet. Which of the following fluids contain high amounts of sodium? Select all that apply. A, lemonade. B, low-fat milk. C, tomato juice. D, hot cocoa. And E, seltzer water. The answers are letters B, C, and D. Why letter B? Well, low-fat milk contains about 103 milligrams of sodium per cup. While it isn't incredibly high compared to some other fluids, it can add up over time if consumed in larger quantities, which is why it's worth noting. And a 2-gram sodium restricted diet means you have to carefully monitor even small amounts of sodium that could quickly accumulate through various food and beverage sources. So your tip in answering this question is to recall that dairy products like milk often contain sodium. So don't overlook them when thinking about sodium intake. Now, what else here? We have letter C. That's tomato juice. Well, tomato juice is also high in sodium with about 900 milligrams of sodium per cup. So this is a significant amount compared to the daily sodium restriction of 2 grams. It's one of the biggest culprits when it comes to drinks that can easily push your sodium intake above the recommended limit. And one tip for you is to be cautious with juices that are processed or made from vegetables like tomatoes, as they tend to have higher sodium content, especially in canned or pre-packaged versions. Now we have letter D, hot cocoa. It can also contain sodium, particularly because it's often made with dry milk powder, which has about 173 milligrams of sodium per serving. While it's not as high as tomato juice, it's still enough to contribute to your overall sodium intake if consumed regularly on a sodium restricted diet. So my tip for you, recall that any beverage that contains milk, processed mixes, or added salt can have sodium. So always double check those ingredients. Now, letter A is incorrect. It contains only a minimal amount of sodium, about 12 milligrams per 12-ounce serving, which is considered negligible in the context of a sodium restricted diet. And this means that it's a safe choice for people who need to limit sodium intake. And so my tip for you is to recall that natural fruit-based drinks like lemonades typically have low sodium content, so you can feel more confident choosing them for a low sodium diet. Another answer that is incorrect is letter E, seltzer water, which is typically sodium-free, so it's going to make it a good option for those on a sodium-restricted diet. However, it's important for you to check the label for any added sodium, because some flavored or sparkling waters may contain small amounts of sodium for taste, but in general, seltzer water is a safe low sodium choice. All right, let's have number 68. After a partial gastrectomy, a patient returns to the surgical unit with a nasogastric tube and IV infusion. The nurse notices no drainage for 30 minutes. There's an order to instill fluid into the nasogastric tube. Which action should the nurse take? A. Instill 20 mLs of water and clamp the tube for 1 hour. B. Instill 50 mLs of saline and increase the suction pressure. C. Instill 15 mLs of distilled water and disconnect the suction for 30 minutes. D. Instill 30 mLs of normal saline and continue suction. The correct answer is letter D. Well, why? Normal saline is the choice because it is isotonic and it prevents any potential electrolyte imbalances which could happen if other solutions like distilled water were used. And saline can help clear the nasogastric tube if there's any minor blockage or, let's say, buildup that's preventing drainage. And by using this type of solution and then resuming suction, we ensure that the gastric decompression continues without further complication. So as a tip for you, when you're dealing with nasogastric tubes, the standard practice is to use isotonic solutions like saline because they mimic the body's natural fluids and can also ensure safety for the patient. Now, let's have letter A, which is one of the incorrect options. Because using air is not recommended, it might help dislodge a blockage in some cases, but it's not the most effective or safe approach because it can cause the tube to become blocked or can cause discomfort for the patient. And also, clamping the tube for 1 hour can also lead to gastric contents to back up, which could increase the risk of complications like aspiration or pressure on the suture line. So when you are in doubt, always select for solutions that don't involve air or other things that could increase risk or cause unnecessary discomfort. So air is generally avoided unless specified in a very specific context. Now, letter B is another incorrect option. We know that saline is the right fluid to use, but increasing the suction pressure can be dangerous. So this can potentially damage the suture line or the tissue in the stomach or intestines. And remember that post-surgery, we want to be gentle with suction to avoid any damage to the healing tissue. So my tip for you is to always consider the patient's safety and comfort, and increasing suction pressure is not a safe solution. It's better to maintain gentle suction and proceed with standard saline irrigation. Letter C, another incorrect option here is, what is this? Distilled 15 mLs of distilled water and disconnect the suction for 30 minutes. Well, distilled water is not ideal because it is hypotonic, which can cause electrolyte imbalances if absorbed by the body. It could also irritate the stomach and disrupt normal gastric function. And disconnecting the suction is not a good idea because it could lead to gastric content accumulation in the stomach, which increases the risk of blockage or maybe aspiration. And keeping suction running helps maintain proper gastric decompression as well. So my tip for you is to avoid using distilled water for irrigation and think about the consequences of stopping the suction. And so in general, you want to keep the suction running to prevent issues after surgery. 69. The spouse of a client reports concerns about the client's sleep habits. Which statements suggest the presence of obstructive sleep apnea? Select all that apply. A. He kicks so much in his sleep that the sheets are tangled in the morning. B. He wakes up from nightmares and says he's terrified. And C. He never wakes up, but I do because of his breathing episodes. And D. He snores loudly and then suddenly gasps for air. E. He falls asleep at the wheel, so I drive instead. The answers here are the following, letters C and D. Why letter C? Because this statement suggests that the client is experiencing breathing disturbances during sleep, but they are unaware of it. So this is a common symptom of obstructive sleep apnea, or OSA, where the airway becomes partially or fully obstructed, causing breathing pauses. And these disturbances often wake the partner, but the client doesn't always realize it. So this is key to diagnosing OSA, as the person with a condition may be oblivious to the severity of their sleep disruptions. So my tip for you is to pay attention to signs where the client's sleep is disrupted due to breathing issues, even if they are unaware of it. It's a telltale sign of obstructive sleep apnea. D is also correct, because loud snoring followed by gasping for air is a classic symptom of obstructive sleep apnea. And this is occurring because the airway becomes blocked during sleep, causing the person to stop breathing momentarily before gasping for air. And also recall that loud snoring is often the result of the turbulent airflow caused by the obstruction, and the gasping occurs as the person's body struggles to resume normal breathing. And so the tip for you to recall is snoring combined with periods of breathing, which is gasping, is a strong indicator of obstructive sleep apnea. And so if you see this combination, it's a good clue for sleep apnea. Now let's have letter A, which is one of the incorrect options. Well, take note that kicking in sleep and tangled sheets are more indicative of restless leg syndrome, or what we call as RLS, or maybe other movement disorders, but not obstructive sleep apnea. Now, just give you a picture about the restless leg syndrome. It is something that can involve a strong urge to move the legs, often accompanied by the discomfort, especially during rest of sleep. And these movements typically happen during the period of falling asleep or doing lighter stages of sleep. And so if a client reports frequent kicking or tossing in bed, think of movement-related disorders like restless legs syndrome, not OSA. Letter B, another incorrect option. It's because nightmares and terrors are usually associated with rapid eye movement sleep disturbances, such as night terrors or REM sleep behavior disorder, but not obstructive sleep apnea. And nightmares are typically unrelated to the breathing patterns that define obstructive sleep apnea. So you got to be cautious of confusing nightmares with sleep issues related to breathing, because they often reflect other sleep problems and are not linked to the airway obstructions in OSA. We have letter E, is also incorrect. This is a sign of excessive daytime sleepiness, which is often a symptom of narcolepsy, which is a sleep disorder that causes extreme drowsiness and sudden sleep attacks rather than obstructive sleep apnea. Recall that the obstructive sleep apnea can lead to daytime fatigue, but narcolepsy is characterized by the inability to stay awake at inappropriate times while they are driving. So it's not necessarily the same as the tiredness seen in obstructive sleep apnea. And so for you to recall or to differentiate between narcolepsy and OSA, take note that narcolepsy is going to impact on daytime. Okay, it's about daytime sleepiness, but the narcolepsy involves there's going to be uncontrollable sleep episodes, whereas the OSA might have some sort of sleepiness during the daytime, but they're totally different cases here. Okay, now for this type of question, I want you to focus on the breathing patterns and also the hallmark signs of the obstructive sleep apnea. These are the loud snoring, gasping for air, breathing disturbances during sleep that will disrupt the person's rest, even if the client doesn't notice it. And also to eliminate those unrelated sleep disorders, such as the restless leg syndrome, also narcolepsy, nightmares. Those are common distractors. Let's have number 70. The nurse is collecting a urine sample from a client with an indwelling urinary catheter. After explaining the procedure, what is the next appropriate step? A. Positioning the client in high Fowler's position. B. Wearing sterile gloves. C. Cleaning the drainage bag exit tube with an alcohol swab. And D. Clamping the tube below the specimen port. The answer is letter D. Why letter D? Because clamping the catheter tubing below the specimen port allows freshly excreted urine to accumulate in the tubing, and this can also ensure that urine collected reflects the client's current renal status, and it also can give you the most accurate and up-to-date sample, as urine in the drainage bag may have been sitting for a while, which could lead to contamination or altered composition. So my tip for you, when you're collecting a specimen from an indwelling catheter, you want urine that is freshly passed, not the one that is already sitting in the bag, which is why you're supposed to clamp the tubing, which is a very important step to ensure that the sample reflects the client's current condition. And so letter A is one of the incorrect options here. We know that positioning a client is important in many nursing procedures. High Fowler's position is not necessary for collecting a urine sample from an indwelling catheter. The client can be in a comfortable position to ensure the specimen is collected properly. And we have letter B as well, wearing sterile gloves. That is incorrect because this procedure only requires clean gloves. We know that sterile technique is required when inserting a catheter, or let's say dealing with an open wound, or maybe collecting a urine sample from an indwelling catheter. Does not need sterile gloves. Okay? Clean gloves will prevent contamination while ensuring safety in this case. Now, what about letter C, cleaning the drainage bag exit tube with an alcohol swab? This is incorrect. Well, it is essential to never collect urine from the drainage bag, as it could reflect urine that has been sitting there for some time and may not be representative of the client's current renal function. And so cleaning the drainage bag exit tube won't help collect a fresh specimen. You should always collect the urine from the specimen port of the catheter tubing. All right? So you have to remember about the step-by-step process and the correct procedure, especially from collecting urine from an indwelling urinary catheter. Number 71. A mother with type O Rh positive blood gives birth to a baby with type B Rh negative blood. 11 hours after birth, the infant's skin appears jaundiced. What is the most likely cause? A. Rh incompatibility. B. Physiologic jaundice. C. ABO incompatibility. And D. Neonatal infection. The answer here is letter C. Why? Because ABO incompatibility occurs when there is a mismatch between the mother's and baby's blood types. And in this question, the mother is type O and the baby is type B. Now, the mother's immune system may produce antibodies against the baby's type A or B red blood cells, which can lead to hemolysis and the release of bilirubin causing jaundice. So this is particularly significant because ABO incompatibility can cause jaundice within the first 24 hours after birth, which aligns with the 11-hour onset in this scenario. So the clue in this question, or in answering this question, is the mother's blood type O and the baby's blood type, which is B. All right. Now let's have letter C, which is one of the incorrect options here. Well, why? Well, Rh incompatibility happens when the mother is Rh negative and the baby is Rh positive. Take a look into the question one more time. In this question, the mother is Rh positive, so she cannot develop antibodies against the Rh factor in her baby's blood. So this rules out RH incompatibility as the cause of jaundice. So you gotta pay attention to both the blood type and the RH factor. And since the mother is RH positive and the baby is RH negative, RH incompatibility is not a concern. Now, what about letter B, physiologic jaundice? Well, remember that physiologic jaundice is the most common form of jaundice in newborns, but it typically appears after the first 24 hours, not within the first 11 hours. And also, physiologic jaundice is due to the normal breakdown of fetal red blood cells as the baby adjusts to life outside the womb. However, because the jaundice in this case presents so early, 11 hours, it's more likely to be pathologic jaundice like that caused by ABO incompatibility. So you need to be aware of the timing, and also that physiologic jaundice usually presents after 24 hours. So jaundice before that time, especially in a case of ABO mismatch, is more concerning and is more likely pathologic. Letter D is also incorrect. Neonatal infection can certainly cause jaundice, but this baby shows no signs of infection, such as fever, no information about lethargy or other symptoms. And so the jaundice appears soon after birth and is more likely related to blood type incompatibility. Now, you got to consider the clinical presentation. If there is no indication of infection like fever or irritability, an infection is less likely to be the cause of jaundice in this case. So you have to focus on the key details. The blood type mismatch between the mother and the baby is very critical. And since the mother is type O and the baby is type B, the most likely cause of jaundice is, again, letter C. Alrighty, let's have number 72. A nurse is teaching a client with asthma to use a peak flow meter. What instructions should the nurse provide? A, take a full breath and blow out as forcefully and quickly as possible. B, place the mouthpiece between the lips and in front of the teeth before starting. C, use the meter twice daily in the morning and evening. And D, exhale while bending over in an upright position. The answer is letter A. Why? It's because the peak flow meter is designed to measure the maximum flow of air that can be exhaled in 1 second. Remember that. This will help to assess how well the client's asthma is under control. And the technique to get an accurate reading involves taking a deep breath, then blowing out as forcefully and quickly as possible, so to ensure the test reflects the client's ability to expel air from the lungs during an asthma episode or when the asthma is well controlled. So my tip for you is to recall that action of blowing out forcefully is crucial for obtaining an accurate measurement. So you have to focus on that one when reading this type of question. Now, letter B. This is one of the incorrect options here. Well, place the mouthpiece between the lips and in front of the teeth before starting. Well, what should be done here instead is that the mouthpiece should be positioned between the teeth, not in front of them, with the lips sealed tightly around it to avoid air leakage. So if the mouthpiece is not positioned correctly, air can escape, which would make the reading inaccurate. So I want you to think about how you'd make the most airtight seal with the mouthpiece. So if it's in front of the teeth, air will escape. It can compromise the reading. Letter C is another incorrect option. Use the meter twice daily in the morning and evening. We know that peak flow readings should be done regularly, but they're typically taken once a day. And the best time is in the morning before medication, such as the bronchodilators. And this is done to assess how the airways are doing after a night's rest. So this will give the clearest picture of the baseline lung function. And so it's important to note that the evening is not the most consistent time to take the reading. So the idea of measuring in the evening is not recommended unless the client is experiencing symptoms or the healthcare provider has other specific instructions. So you have to recall that morning is the key time for consistency, and it's helpful to remember this when reading the answer choices. Now, what about letter D? Exhale while bending over in an upright position. Well, remember that when using the peak flow meter, the client should be sitting or standing upright because this can allow the lungs to fully expand. And in this option, bending over could interfere with the proper lung expansion and could cause the test to produce inaccurate reading. So I want you to pay attention to the body posture here. The goal is to allow the lungs to function, and bending over would interfere that. So eliminate this one. So for you to accurately answer this question, you've got to focus on the correct techniques for using the peak flow meter. And the main point is that the client needs to exhale forcefully and quickly and to get the best reading. And this is the primary action that makes an accurate testing. Also, you have to eliminate those answers based on improper positioning or unnecessary steps. So, for example, options that suggest the wrong mouthpiece positioning or bending over will not contribute to an accurate measurement. 73. A nurse suspects opioid withdrawal in a newborn. Which sign supports this suspicion? A, grunting and low-pitched crying. B, irritability and nasal congestion. C, watery eyes and rapid breathing. And D, lethargy and constipation. The answer is letter B, irritability and nasal congestion. Take note that opioid withdrawal in newborns can have a range of symptoms because opioids affect both the central nervous system and the respiratory system. And so take note that irritability is a hallmark of CNS stimulation, meaning the nervous system is revved up during withdrawal. Okay? We're talking about withdrawal because it's a newborn, right? It's a common sign that the baby is uncomfortable. So the baby is no longer getting the unwanted narcotics from the maternal circulation, no longer. Okay, so the baby here is actually withdrawing. And the nasal congestion is another symptom that often shows up with opioid withdrawal. This congestion is actually part of the respiratory issues seen, and it makes sense because the body is working hard to adjust the absence of opioids. So I want you to recall the two symptoms together, irritability and nasal congestions, which can strongly indicate that the baby or the newborn is actively withdrawing. Now, letter A is one of the incorrect options here because these symptoms are more commonly associated with respiratory distress or cold stress, but not opioid withdrawal. And also grunting is the body's attempt to keep the lungs open during respiratory issues. And the low-pitched cry could be a sign of distress, but it doesn't point specifically to opioid withdrawal. And so if the baby's cry is more high-pitched, it could be more typical of opioid withdrawal. So a low-pitched cry would raise questions about other causes. Now, letter C, watery eyes and rapid breathing. Why is this incorrect? Well, remember that watery eyes and rapid breathing could be symptoms of a respiratory infection like syphilis or maybe a cold, but they are not the primary signs of opioid withdrawal. And these symptoms are more commonly linked to infections where you might see a more generalized set of symptoms, including let's say respiratory distress and also watery eyes. Lastly, we have letter D, lethargy and constipation. Why is this Incorrect, because lethargy and constipation could be signs of other neonatal conditions. It could be from hypothyroidism, but they are not typically for opioid withdrawal. And I want you to really internalize this, that opioid withdrawal tends to make newborns more irritable and restless rather than lethargic. And also the constipation could occur with opioid use in older individuals, but it isn't the most characteristic symptom in neonates with withdrawal. So for you to answer this question, I want you to focus on the key symptoms such as irritability and nasal congestion. Number 74, a client in the early stages of Alzheimer's disease is transitioning to a long-term care facility. Which interventions should the nurse initiate? Select all that apply. A, create a routine with regular rest periods. B, discuss the client's financial management and community resources. C, organize weekly group activities with senior citizens. And D, track the client's weight on a weekly basis. And E, provide specialized equipment to assist with rehabilitation. And F, keep the client in casual clothing throughout the day. Let's take a look at the answers. These are letters A, D, and E. Why letter A? Because clients with Alzheimer's disease benefit from a structured daily routine that can provide consistency that will reduce their anxiety. Also, building in some rest periods is also crucial because dementia can cause fatigue, and the regular rest can help prevent overstimulation. And remember that this approach provides both security, stability, and are essential for the client's emotional and mental well-being during the transition to a care facility. Letter D is also correct because weight monitoring is a key component of caring for clients with Alzheimer's disease, especially in the early stages. Take note that unexplained weight loss could signal nutritional problems like difficulty eating, swallowing, or a poor appetite, which are common issues in dementia patients. And so regularly tracking the weight can help you identify the nutritional deficits early on and also allows for appropriate interventions like dietary changes or assistance with eating. Letter E is also correct because assistive devices or specialized equipment can also promote independence and self-care in the early stages of Alzheimer's. And take note that these tools will help client with their activities like dressing, eating, or mobility, and supporting their dignity and also enhancing their quality of life. And this can also ensure that the client has access to these resources, which can help them maintain some autonomy and also to reduce their frustrations. Now, letter B is one of the incorrect options here because in early stage Alzheimer's, patients often struggle with memory, also struggle about decision making and comprehension, and it's going to make it inappropriate for them to manage their finances or even engage in discussions about complex topics like community resources. And involving the client in these discussions could lead to confusion, some frustration, and a sense of helplessness. So it's better to involve family members or caregivers to manage such concerns rather than the client themselves. Letter C is also incorrect because group activities involving large numbers of people or complex tasks can be overwhelming for individuals with early stage Alzheimer's, and these clients may have difficulty engaging in group discussions or activities that require more advanced social skills or cognitive processing. So it's better to focus on small, manageable activities that can align with the client's interests and cognitive abilities rather than forcing them into potentially stressful group settings. Letter F, another incorrect option, because encouraging the client to wear appropriate clothing instead of pajamas or robes can help them maintain a sense of normalcy and self-respect. And I want you to know that wearing regular clothes can also promote a sense of dignity. It can help the client maintain their self-image, which is important as their independence begins to decline. And so casual clothing that is not overly informal or overly structured might be appropriate, but it's important not to limit the client to too relaxed an attire. And so for you to answer this question, I want you to look for interventions that provide structure, provides independence, and physical health. And so, for example, options like routine, weight monitoring will focus on maintaining the client's stability and overall well-being, which is key in the early stages of Alzheimer's. And I want you to eliminate those options that involve potentially overwhelming or inappropriate tasks. For instance, financial management, group activities could stress the client and can lead to frustration, which doesn't align with the supportive goals of Alzheimer's care. So I want you to focus on what would help the client maintain dignity and independence. Let's have number 75. Finally, a client with an emphysema is suspected of having a spontaneous pneumothorax. What should the nurse do in addition to notifying the healthcare provider? A. Administer oxygen at 2 liters per minute via nasal cannula. B. Position the client on the unaffected side. And C. Give 60% oxygen via a venturi mask. And D. Prepare for IV administration of electrolytes. The answer is letter A. Why letter A? I want you to look back into the scenario. Patient has emphysema, right? It is a chronic obstructive pulmonary disease where the lungs lose elasticity and cannot effectively exchange gases. So in these patients, low levels of oxygen are the primary stimulus for breathing, not high levels of carbon dioxide. Okay? And administering a low flow oxygen, let's say 2 liters per minute via nasal cannula, can ensure that oxygen is adequate without overwhelming the respiratory drive, because giving too much oxygen could reduce their natural drive to breathe, can potentially worsen their respiratory status. It can cause carbon dioxide narcosis. So the key here is avoiding high oxygen concentrations, which can trigger hypercapnia, especially in patients with emphysema. So letter B, one of the incorrect options here, is actually it's incorrect, because when pneumothorax occurs, there is air in the pleural space causing the lungs or the lung to collapse. And so in this case, positioning the client on the unaffected side could exacerbate a mediastinal shift and the movement of the heart and other structures toward the unaffected side. So this can actually worsen the pressure on the already collapsed lung and can lead to increased respiratory distress. So I want you to remember about proper positioning for a pneumothorax would typically be on the affected side to help reduce the air pressure in the pleural cavity and to allow the affected lung to expand more fully. What about letter C? Yes, this is one of the incorrect options here, giving 60% oxygen via venturi mask. We know that the venturi mask provides precise oxygen concentrations, but take a look into the percentage of O2, 60%. That is too high for a patient with the emphysema. As I have mentioned earlier, emphysema patients rely on low oxygen levels to stimulate their breathing, and high oxygen concentrations can impair their natural drive to breathe. It can cause them to develop hypercapnia whenever there's going to be excessive carbon dioxide in the blood. So in this case, high flow oxygen is not appropriate. All right, we need to avoid this. What about letter D? Prepare for IV administration of electrolytes. This is also incorrect. We know that electrolyte imbalances may occur in some conditions, but they are not a primary concern when managing a patient with a pneumothorax. The priority is addressing the pneumothorax and ensuring proper oxygenation and respiratory support. This is typically not necessary unless there is an indication of dehydration or maybe renal failure or other underlying issues. So in this case, the focus should be on managing the respiratory issues related to pneumothorax and emphysema. So in order for you to successfully answer this question, you have to recognize the specific needs of a patient with emphysema and pneumothorax. And again, emphysema patients have a reduced ability to exchange gases, and giving them high flow O2 can impair their natural respiratory drive. Alrighty. Again, you are invited to enroll to the NCLEX course. So kindly visit stankosnclexcoaching.com. You have completed the 75 test questions in this series. And so I hope that this presentation has offered you useful insights and improve your approach to the test taking strategies. And so I'll thank you, and I'll see you again in the next series.